Hello, Surgery Sim speaking. How can I help?
How's your anxiety?
Doctor, you know I haven't been in a good place. I'm trying to get better and it's just hard.
I think it's worth referring you to get this all checked.
Yeah.
And I think we need to do it urgently on what's called a cancer 2-week wait referral.
Ignore the behaviour you don't want to see again and reward the behaviour that you wish to encourage.
It tickles.
Yeah, sorry. It's always tender.
I had that breakdown.
Yeah.
Then I was made redundant.
Yeah.
And I found out this is aneurysms. It's all going downhill.
It never comes in ones.
No.
Your appointment was at 10:10.
10 past?
Yep.
We're gonna have to wait a long time to be seen. It is manic.
With a bit of luck, I'll be running to time, but I won't guarantee it. Evelyn will see how we go.
That's why my blood pressure goes.
Yeah, I'm not surprised.
Sandra, take a seat, darling. I'm just going to speak to the doctor.
Yeah, because I'm already...
Yeah, that's fine, my darling. We didn't arrive you. So it's our fault, but I will just speak to the doctor.
Hello?
Hi, is that Serena?
Yes, hello.
Hello, darling. Did you get my screen message?
Yeah, I've just replied because I was with a patient.
OK, she's been sat here 2 hours.
2 hours?
Well, she came to book at 8 o'clock and then they forgot to put her in. Forgot to arrive her.
So she'd been in the waiting room from 8 o'clock?
Yes.
So whose fault is it?
Hours.
OK, I'll meet her then. OK.
OK, thanks, bye. She's going to see you. She's going to call you now, darling. OK.
I've had a horrible morning.
Well, fine.
I made a mistake this morning.
This morning I made a mistake because obviously when it's so busy and we're booking in patients.
Sandra Temraska? Hello. It's Dr. Hyder. Come and have a seat. I'm sorry you had to wait so long. And how can I help you today?
I just have some infection in my nose.
OK.
And I have some in my face as well.
So how many weeks pregnant are you?
7 or 8.
OK. So any fever at all?
No.
OK. Cough?
No.
No? OK, that's all right. So let's just look at the back of your throat to start with. Let's just do a big ah. Yeah, OK, so it's quite red.
Yeah, because I'm vomiting.
Oh, you're vomiting because of the
Yes.
pregnancy as well. Yeah. Let's have a look in your ear. OK. A little bit red, actually. Yeah. So both of the eardrums look like there's some pressure behind them as well.
Oh.
Now, that can sometimes be if there's an infection going on here. Can I listen to your heart and breathing?
Yes.
OK, you're OK. No, it's fine. I just want to feel your face. Is pain across here at all when I'm pressing? No. What about across the front of the head?
No.
But you're feeling congested up here?
Yeah, I just feel like here.
Right, OK. When you blow your nose, what colour is it? Green, white?
Green.
Green, oh, it is green. OK, your chest is all clear.
Okay.
All right, so I think it is coming from the sinuses, the infection. Come and have a seat. Are you allergic to any antibiotics? No. So we could give you some amoxicillin, which is OK in pregnancy.
Okay. But can you give me any cream for that or something?
Let's have a look inside. So it's feeling very sore, is it?
And it's really...
Yes, yeah. Yeah, I can give you some cream for that as well.
Yeah.
So that's your antibiotics and that's the cream.
Okay.
OK? And then come back and see us if you're not feeling better.
Okay, thank you.
All right, I'm sorry you had to wait so long. Take care then.
Thank you.
Bye-bye.
Bye-bye.
Hello. In we come. Come in, take a seat.
Thank you.
How are we doing?
Yeah, actually, he was coughing.
Right.
All night.
Yep.
All night he was crying with a runny nose and coughing very badly. And he vomiting as well. He bring all milk out. So that's why we're worried about it.
Okay, we'll have a listen to his chest, shall we?
Yeah, that's fine.
And see what it's like. Let's have a quick take of his temperature. Oh, that's a smile, isn't it?
Yeah.
Thank you.
All night he was crying and now he's smiling.
Absolutely. Well, there we go. There's a cough as well. So we're going to have a listen to that. Okay, if you just pop his head to the side slightly, and we'll just try this temperature first. Okay, so no temperature, which is good news. We'll have a listen to that chest before he starts crying. Oh, you're not going to cry here, not when you look so happy.
All right, or shall I remove the...
That's fine.
Is that right?
Okay, so his chest is nice and clear. He does have a little wheeze to it, okay?
Yeah, sometimes I feel like
yeah.
when he breathes,
You can hear a
uncomfortable.
slight wheeze at the moment. Now, okay, so let's talk about the good signs. Okay, the good signs are that his breathing is nice and slow. He's not panting. He's not panting away very fast and rapidly, which would be a bad sign. He's not grunting when he breathes. Like that. That wouldn't be good. He does have a little wheeze, so there must be a little bit of narrowing of his airways to some degree. All he's got at the moment is probably a little viral infection that's given him a slight wheeze, okay? So what we need to do is give him, he's only tiny, but that we can use an inhaler to try and help that. What I'm going to see if I can do is get one of the nurses just to show you how to use that.
All right.
Okay, 2 seconds. Let me see if I can convince one of my colleagues.
Yeah.
I've got to see a doctor. I'd like to see Dr. Morrison.
Right, well, actually, your doctor is Dr. Ward.
That's Dr. Ward, is it? Okay. It's a good name for a doctor, isn't it?
Yep, absolutely.
You haven't got a nurse surgery, have you?
I mean, don't worry if he gets a bit upset and, you know, if he's crying when you're trying to give him it, because sometimes that's better, because as they're crying, they're taking deeper breaths.
Deep breath,
so it's...
The medicine goes in.
Yes. Pop it in. Okay, right, so we'll just see how he takes it. What's that? Good boy. Oh. That's it, good boy. So this is just to help with the cough whilst he's coughing so much. All right, okay then. All right then, take care, bye-bye.
Terence Edwards. I'm fine, how are you? Nice to see you.
Thank you.
That was a good result yesterday.
Yeah, brilliant result.
Wasn't it? Yeah. I didn't see that coming. Made your
No.
day, good.
Made my day.
Good, good. How are you?
Not too good, because they classed me with mild heart failure now, Chris.
Okay.
My feet are still swelling.
Uh-huh.
I'm still out of breath a lot, and I'm still coughing in the mornings.
Right, okay.
And I'm finding it very hard to walk long distances now.
Okay. So who's looking after you? Is it the hospital or
Nobody.
Is it us? Nobody?
It is.
Okay. Who would you like to look after you?
You.
Anybody that heart attack or stroke in a young age?
My dad had a triple heart bypass about 2 years ago.
With the heart failure, how are things with that? Are you managing to get around and not be breathless too much?
Try not to think about it.
Yeah, okay.
Put this analogy as a boiler system in a house. Your heart is a pump, like a boiler. They say if you don't open, the pressure will be so high that your boiler will break down.
You've had 3 heart attacks.
I have, yeah.
Oh, gosh.
I could still be here, really.
The other thing that it shapes is that you have an irregular heartbeat.
I found out every time I was running, my heart was going insane.
So what did they do?
I had a heart ablation, and
You're cured.
that's been fixed.
That's been
very,
fixed.
very, very pleased with that.
Excellent.
So what do you understand by the word heart failure?
I don't know. No one's explained nothing to me, Chris. Nothing.
So we all get heart failure.
Yeah.
If even the fittest athlete runs down the road, eventually they will get out of breath, and that's because the heart can't pump the oxygen around the body enough. In your case, you're getting it short of breath at a very early stage of exercise, and this is because your heart is enlarged and it can't pump as efficiently, so it can't get the blood around the heart, around the body as well as it would like to.
Yeah.
When you go to bed at night, you lie down, all this water that's collected in your ankles drains back, because your feet are up, to the heart, and then there's too much fluid in the blood circulation
Right.
and in the lungs, and so it tends to collect in the lungs, and it makes you cough.
Yeah.
And it makes you feel short of breath at night.
Yeah.
So one of the things we need to do is to reduce the amount of fluid in your body. One of the ways we treat heart failure is giving patients diuretics or water tablets, which reduces the amount of fluid in the body by increasing the amount that we pass out in urine. This, therefore, gives less total fluid in the body, reducing the strain on the heart to get the blood pumped around the tissues and back to the heart. The other thing is to try and make your heart beat more efficiently.
Yeah.
Now, you're on some tablets for that, but there's another tablet we ought to give called a beta blocker, which we know helps your heart to beat more efficiently.
Okay.
Now, you have to be careful with these. If you give them a too high dose, it makes the heart slow down so much it doesn't beat enough to get the blood around, and so it makes the heart failure worse.
Right.
So we start off at a very low dose and work our way up.
Okay, Chris, yeah.
Okay?
Yeah.
And increase the doses until we get you feeling better.
Okay, Chris, yeah.
Is that okay?
That's fine, yeah.
Right.
I had that breakdown.
Yeah.
So I was under the doctor's consultant for that now still.
Yeah.
Then I was made redundant.
Yeah.
Then I find out this is happened ever since. It's all going downhill.
It never happens in ones?
No.
Can I see you first thing next Monday morning?
Okay, Chris.
Could you also, please, for the end of this week, have a blood test done?
Yeah. Thank you, Chris.
Okay,
yeah.
take care.
Yeah,
All the best. See you next week.
Yeah, cheers.
Bye-bye.
Bye, Chris.
So it's something for his skin, is it?
Yes, please. That's the one.
So mometazone?
Yeah,
that's a really strong steroid cream.
Yes, sir.
This is not something that we would ever put on repeat for a child. Importantly, what we need to assess is how is his eczema?
His skin is fine. If you can have a look over here, everything is...
So you can see there's some redness just here, can't you? Kind of classical eczema, dry skin. Yeah. How about his arms?
Arms? It's here.
Oh, wow. OK. How about legs? I like your trainers. OK. So that looks quite sore, doesn't it? You can see he's been scratching at it. OK. What's his bath time routine like?
His bath time routine is like two or three times a day, a week.
OK, so not having bath every day. We know that things like soaps, shower gels, bubble baths, they all make the skin dry. He doesn't use any of those. That's perfect. What we could give you is a tub of cream, and when he is having a bath or a shower, you can rub that in all over the body and then just wash it off. Twice a day is good. It would be even better if it was 3 times or 4 times a day. Here's the crucial bit. Eczema is a dry skin condition. If you chuck moisture at dry skin, it's going to be perfect. It will work. That means then you don't need the steroids. Because we are really reluctant as doctors and clinicians to give steroids, especially in a child as young as Nirmit, who his skin is not going to be like your skin. Okay, it's going to be thinner. And steroid side effects are that they make the skin even thinner. So these should be reserved only to use when there are flare-ups of eczema. I'm really concerned about how strong that is.
No worries.
And at the moment, actually, his skin's not that bad. It doesn't need the really strong steroid. So I'm going to keep those 3 things on repeat. So Cetraben will be on repeat, soap substitute tub on repeat, and an antihistamine to drink once a day. And that's his regular treatment. That's the time to come and see us, and we assess the need for steroids.
That's fine.
All right? And it looks like we can send this prescription electronically just to the pharmacy. I'll do that right away.
Thank you very much.
You're welcome. Nice to meet you too. Take care.
Say bye.
Bye-bye, young man.
Bye-bye. Have a nice evening.
Be good.
Enjoy.
Take care, you too.
Why do people have paracetamol on prescription?
Don't know, it's 16p in shops.
But it costs us like £10. Well, not us, but you know what I mean. Oh, my God.
I've had a bad morning. I can't breathe properly.
I was going to say, is it your chest or your stomach? I couldn't tell.
I couldn't tell. I don't know. What I've been having like in the night time, like food is stuck in my here.
Yeah.
But I've been coughing. I've been taking my inhaler.
Yeah.
And I know I'm really chesty at the moment.
Okay.
Yeah.
Anything coming up?
Yeah.
What colour?
Brown.
How's your anxiety?
Don't have my moments, but don't feel too bad at the moment. But I'm anxious about certain things. So I've got a lot of changes going.
Yeah.
I'm going to go back to work.
Okay.
Part-time. I'm going to go back because my sick note finishes on the 15th, but I need to get back.
Do you think some of how you're feeling might be related to that this morning?
I don't know. I was trying to remember when I had these sort of feelings before, and I'm thinking when I used to have really bad asthma when I was little.
Okay, let's have a look.
It feels like it's my lungs, and I was thinking I've got lung cancer, I'm dying. Doctor, you know I haven't been in a good place. I'm trying to get better, and it's just hard. My daughter's at grammar school, and she's studying PE, and it tells you about health. It says that the definition of health is to be able to take normal stress in a normal way.
Okay.
And I don't, so I'm not healthy.
Can I get you to stand up for me?
I'm not healthy,
I want
doctor.
to have a listen at the back, okay?
Right, it was with Dr. O'Donnell. Your appointment was at 4 o'clock. You're late.
I did try to bring him, but...
Can I ask why you're late?
Well, I've had to walk all the way here and been in pain.
You're Katrina Lillywhite. She's about 10 minutes late, well, nearly 12. 12 late because she had to walk to the surgery. Are you still able to see her? Or? OK, no worries. Thank you. Right, he will be able to see you, but you will have to wait until the other people have been seen who have been on time.
How long's that going to be?
I don't know. And he will see you as and when, OK?
Yeah, that's fine.
Oh, what kind of a driver are you? Good.
This pushchair.
How are you?
I'm good, thank you.
Can you manage?
Yeah,
good.
that's it, we're in.
Okay, good. Hello, boys and girls. So, what can I do for you? Sorry for keeping you waiting.
No, that's fine. Basically, what it is, I suffer with abscesses and boils
Okay, and where do you get them?
under my belly and on my legs.
Okay, and how long has that been going on for?
Enough 2 years now.
Really? Okay. Mm-hmm.
They referred me to plastics.
Yeah?
Had the hospital appointment yesterday,
Yeah.
but I'm in literally pain.
Yeah, and what did the plastics say?
They're referring me to a specialist that
Deals with this, yeah. Okay. Okay. And right, just pop yourself over here. So just show me where this is troubling. I see, yeah, indeed, yeah. So these are predominantly associated with weight and with excess tissue rubbing on other tissues. So because this comes down and it rubs against your lower abdomen, your thighs, it causes friction. And the friction weakens the skin, and bugs that normally live on the skin but normally wouldn't cause a problem.
It hurts all down the bottom.
Oh, I can imagine. I can see that it is inflamed. Do you have any under your arms?
No.
No, it's all down here, yeah.
It's all
yeah.
down here.
Yeah. Right.
Stand up.
Mm.
Right, someone come down, please. Right, come and sit down here with Mummy.
Good.
Come on. Yeah, sit there then. Good girl.
Can I get you to come and lie down on there? Because you were talking about that food sticking, weren't you?
Yeah.
Is that okay? Yeah. How can you feel it?
It's a bit painful there.
Okay, that's fine. I'll get you to sit back up. You all right?
Yeah.
Let's just say say again. Yeah, let's do it on the red side. Do you know what?
What?
Your saturations are fine. Your chest is really nice and clear.
No, so what's happening?
So I think it's just a cold, really. But I wonder whether the stress is making everything worse as well, which is why you were getting some of that food sticking symptom as well.
Yeah.
But let me put it to you like this. I'm not worried that your chest is too bad at the moment. And of course, I want you to stop smoking.
I am.
Because that's going to make all of that stuff
Yeah.
worse.
But if I had lung cancer,
Okay.
would I be getting food trapped in here?
What's making you worry about cancer?
Because my dad smoked a lot. My dad was a heavy smoker.
Okay.
He had throat cancer.
Okay.
So I got scared last night.
At the moment, there's nothing in there that makes me worry about cancer right now.
Okay.
But of course, you're right. With the smoking, you've got
Yeah, I know,
the risk is
yeah.
higher, isn't it? Which is one of the reasons why I want you to stop.
Yeah.
I mean, I know you've done well, haven't you?
And I've given up the Red Bull.
Yeah,
And
good.
I'm working on trying to give up this. I haven't got my patch on today.
Do you come to the clinic here?
I started and I stopped because I had so much things going on. But I'm now going to be.
So you're going to restart it? Okay, fine. So in the short term, it is literally just things like paracetamol and stuff. But I'm going to give you something for the stomach as well.
Okay.
Is that okay? If you think things get worse, then I want you to come back to us. Okay?
Okay. Thank you.
No problem.
Take care.
Take care. All right.
I'll see you again.
You too. See ya.
See ya. Bye.
I think you need a combination of antibiotics at this stage, really. it would be really good from your skin point of view if you're to avoid all forms of sugar. So no sugar into your coffee, no sweets, cakes, chocolate, paste. Just don't eat anything with sugar.
Chocolate.
Do you take any sugary drinks at all?
Oh, the only drink I do drink is Ribena.
Yeah, it has sugar. You know,
I can't drink plain water.
one thing that sugar does is it weakens the immune system, and your immune system isn't able to respond as well. Try and steer clear of sugar, because sugar and friction and genetics are what contribute to this kind of situation. Okay?
What? No. Enough now. Come and sit down. Pull your trousers up, please. I'm here, Albie, I'm here.
Yeah.
What are you doing? Stop. Leave him. Right, that is enough. Sorry about this.
No, it's just sometimes children are like that.
Whatever it is, because they want to run about and do things. That's what it is.
Yeah. The best thing to do with children, as you probably know, being a mum yourself, is ignore the behaviour you don't want to see again and reward the behaviour that you wish to encourage. So just ignore, when they're doing things that you just continue to talk as if they weren't doing it. They'll eventually stop.
It is hard, though.
I know it's hard, yeah, I know it's hard. And the thing is, any response from you is a reward. So even if you give out to them, it's a reward, because they're getting your attention.
Right, come on, let's go home.
Bye-bye. Yeah, time to go. Yeah. Actually, they do very well on ignoring them. Yeah.
Beautiful, thank you.
How can I help?
I came in to see Dr. Moyes a week ago on Saturday. She sent me out to the hospital for some blood tests, X-ray to do, because I have this disease. So I was 8.5 months off work last year.
Right.
8 weeks in hospital, 2 weeks in intensive care.
Gosh, okay.
Something's not right.
Consultation line, Kerry speaking. How can I help?
I'm getting very fatigued again. I think I'm putting weight on around my midriff again, which is what I did prior to presenting with this in the first instance. I don't appear to get anywhere near as much oxygen into my lungs as I did. So basically, I've come back today to try and get some results because I'm feeling I'm starting to rapidly go downhill.
David was diagnosed with a very rare condition called thrombotic microangiopathy and ended up on intensive care. This condition affects the small blood vessels in our organs, most often the kidney, and causes them in some cases to shut down, which is what happened with Mr. Taylor. He required dialysis of his blood. Your full blood count was normal, so there's nothing wrong with the actual blood cells. Your kidney tests were much in line with the ones you've had before. And actually, probably your function of your kidney is better than it was.
Obviously, I know that I've got kidney damage from the disease, but in my mind, I'm thinking, have I got other damage? You know, so is it likely that or is it possible that I have lung damage? And clearly, from what I've been reading, it's a possibility. So
and you're having some lung symptoms. So I think what I'll do is I'll write a letter to the chest clinic and get them to give us a second opinion, and we can take things forward that way.
Okay, that's great.
All right.
Lovely. Thank you very much.
No problem.
Okay.
Take care. Bye bye.
Come in, all.
Very much, thank you.
That's it. Have a seat just there.
You up there?
Yes, please. Yeah.
Very much.
Right, so blood tests. Have you got a good vein for me?
I do hope so. You'll be useless. I just look the other way.
Oh yeah, we're used to that. That's
Good
fine.
girl, thank you. Good young lady. I'll be really formal. Thank you, nurse.
Oh, thank you. Don't worry about it. It's very common. Right, here we go. Sharp scratch. Well done. You okay?
Yes, thank you. Yeah, thank you. Yeah, on the television, I can watch stabbings, killings, kicking, shootings. If hypodermic comes out, I look away.
Really?
Yeah.
Oh, that's all right. Right. So give that a really firm push. You may have a colourful bruise on that one.
Oh, it's normal, yes.
Oh, do you bruise easy? Yeah. Okay. As soon as I went in, it just ballooned up.
Thank you very, very much.
Oh, gosh, that's going to be a lovely bruise.
Is it?
With pretty colours.
It's been a pleasure to talk to you, thank you.
All right, give that a week. Any concerns, we will write to you.
I've enjoyed meeting you. Thank you very much.
And you, take
Bye-bye.
care. Bye-bye now.
So, the mole.
I have a mole.
Yeah.
Yes.
So we've got this mole on your back, I think. Any bleeding or
Haven't
pain
noticed
around
any,
it?
no.
I know that moles can be a little bit dodgy sometimes.
Yes.
So
Any family history of any skin cancers or anything like that?
No.
I've had one before.
Yeah, taken off.
Yeah.
Yeah, okay.
Yeah.
I just got a thing about moles.
If you have any moles that are either suddenly becoming quite asymmetrical, so they were around and now are irregular, if you find that they're getting bigger, if you're getting bleeding or itching from them, or they're changing colour, you know, all of those things are quite sort of important to keep an eye on, and if they happen, then come and see us. And yeah, keep using the sunscreen.
Yeah.
That's Julie, who's our HCA for today. All right, come and have a seat down there on the blue chair. So just remind me, it was the 4 on the back, wasn't it? And they were starting to crust and catch on things. Weren't they?
I think, yeah.
Okay, so the idea is the things that you've got, they grow on the surface of the skin like that. So what we do is we put a needle under here, inject some local anaesthetic under there so that you can't feel any of that. We just slice them off the base and then stick a plaster on the top. That's it. Yeah?
They won't come back. Can they?
They can come back. They can come back in other places because that's just to do with skin type. We try our best to make sure that doesn't happen. All right, can we get yourself ready? I'm just going to get the local anaesthetic ready. Okay. That should be fine. So you're just going to feel a bit of a sharp scratch under each one when I do it, okay? Just one coming now. Okay, so that's the 4.
Why do they come on the back then?
They can come anywhere, really. Some people are just prone to them. I mean, the good thing about them is that they're almost always benign. The bad news is that you tend to get more as you get older.
Right, okay.
Busy. You're taller.
Oh, you can raise it? Wow, that's nasty. I like that one.
It's nothing particularly sophisticated, really. It's just sort of scraping it off. Not feeling anything sharp, right? Usually the sound is worse than it actually is. All right. All right. That's it, all done. So keep it dry for a couple of days. And then Karen is normal. All right. Take care. See you later.
Do you have that whole northern southern divide in your house for the accents?
We call them pants.
Yes, I have that in my house.
And you call them trousers. I asked Margaret, and Margaret was like, I've got trousers on, yeah. Yeah, and do you call pants like underwear?
No, it's just weird. Oh, God.
Hello.
Hello, Doctor.
Come on in, Leslie.
Thank you.
So I've been reading letters about you, yeah?
Oh, you got a few.
I've got some, yeah. So you went to the Blackouts clinic, and
Yes.
was there a cardiology letter I got this morning?
You should have a cardiology, respiratory, and a blackout.
Wow. Leslie has been diagnosed with bird fancier's lung, which is an allergic condition. It can be triggered by bird feathers, by animal fur, by quite a lot of things. In his case, we think it was probably bird-related. At one point, Leslie was keeping up to 500 birds. What is it that you're scared of? In the past, Leslie's been very anxious about his health, and that's sometimes made it more difficult to treat. Shall we start with the respiratory?
Right.
They were quite happy with you, weren't they?
Yes, I think so.
CT scan looks okay?
Yes, they've got...
Nothing nasty going on?
No, as far as they're concerned, it looked good. I'm getting better sleep.
Yeah.
Got a better mindset.
Feeling more...
I got a better mindset at the moment because after waiting 18 months with nothing being done, it's at least something being done at the moment.
And you know that things like your lungs, you may reach a stage where they say this is probably as good as we can get.
As I said to you before, I didn't expect it to be any better. I just want to know that it's got worse or it's still the same. And when will I be seeing you again?
Well, shall we wait until you've had some of these tests done now?
Right.
Yeah? So when you've had the angiogram, when is that?
Week today.
Tuesday. A week today, OK. So if I see you a couple of weeks after that,
Okay,
yeah?
that'll be fine.
Gives time for them to get a letter to me.
I'll put an appointment at the end of the
You
month.
can squeeze me in with all your other appointments, yeah? It's very satisfying to see Leslie in better health. He's breathing better, his mood has improved, he's just generally more cheerful.
Thank you very much, Doctor, for your... I say good to come in and find I'm not as bad as I used to be.
Take care, bye-bye.
Bye-bye.
Musa Siddiqui? Yeah. Oh. Come and take a seat. Your mum, yeah? Yeah. Lovely. I just bring up Musa's files, and Musa is 13 years old.
Yeah.
13 and a half. Lovely. How can I help?
OK, so he's been having problems with his right ear for a few weeks now, and he constantly feels he needs to pop his ear.
And any recent travel on a plane? Nothing?
No.
So just started with what, a bubbly sound?
When you, don't unpop it, it hurts even more when you pop it.
Yeah.
But, if you just keep constantly popping it, it doesn't hurt.
And have you had any trauma to that ear? Have you had a hit to the head or anything at all?
No.
OK, and have you had any water that's gone into that ear recently or done any swimming recently?
He hasn't done swimming, but he does have showers a lot. That's what I was thinking, maybe, but whether that's normal or what.
OK. So sometimes you can get this thing called Eustachian tube dysfunction. That's the tube, the Eustachian tube that connects your throat, your ear, nose and throat, basically, and it can get blocked with phlegm. So the outside of the ear, and then there's the eardrum, and then which is that thin flap, and then you get the middle ear, and you have to constantly make the pressures the same by doing that popping sensation that you're doing. Let's just do your temperatures and things. Any no swelling or any pain behind the ear or anything like that? OK, let's have a look in the normal ear. So you've got some wax in this ear. There's a couple of little hairs, actually, right at their back. But the eardrum's intact and it's shiny. I think it's a little bit white, so a bit of fluid behind the eardrum. But actually, the eardrum's intact. It hasn't popped or burst or anything like that. There's nothing nasty in there. Because he's 13, I think we should try the spray and the eardrops to help alleviate this popping sensation. If you do have any mucus in the nose, blow it out, try to get it out because it can get stuck. There you go.
Thanks.
Lovely. There you go.
Thanks
Cheers,
a lot.
bye.
Thanks very much.
Yeah, I'll go to lunch at 1. I've got cottage pie.
You've got cottage pie, love?
Yeah, cottage pie.
Cottage pie.
Cottage pie.
Oh, I want cottage pie. What's cottage pie?
It's got mashed potato and like mincemeat underneath it.
Is it because it's made in a cottage or something?
Yeah. And the shepherds make the shepherd's pie.
Which one's lamb and which one's beef?
Beef.
Shepherd's pie's lamb.
Oh, shepherd's pie is lamb.
Cottage pie
is the beef.
Hello, it's Dr. Hyder. Come and have a seat. And how are you?
Not too good.
What's been happening?
I've been getting pains.
Okay.
And it's been going on for a long time. That I get loose bowel motion.
Okay, all right.
But the pain is really bad, and sometimes I don't feel like eating, but I've got to eat because I'm on tablets.
Yeah, so what's happening with your bowels? Are you loose or are you constipated?
No, loose.
Loose. Okay. Any blood in the poo?
I never know. I never look. I just go and that's it.
All
But
So how long has it been loose for, do you think?
For a while. And I've also lost weight.
How long have you noticed the weight loss for?
About a month.
About a month. Okay, all right. And then the change with your bowels, how long has that been?
About 6 months, I suppose.
Okay, so that's quite a long time,
It is a
6
long
months,
time,
isn't it?
but-
And then the pain, for how long?
About a month.
About a month as well?
It's not,
okay.
yeah.
And appetite, can you eat?
I'm not really fancy anything.
And the weight loss, how much weight have you lost, do you think?
I was a size 22 and I've gone down to 20.
Right.
And even these jeans are 20 and they're loose.
Okay. Has anyone else mentioned that they noticed that you've lost
Yeah.
weight?
Hi, girls. If you've got any appointments, I need stronger tablets. I've been given a course, I'm in agony.
Right, I can put you on telephone triage.
But I've got to go work after, so I just need to repeat.
Yeah, I know, but I can't. I've got nothing I can book you
Well,
into.
can you not ask the doctor just to give me more tablets? I ain't sleeping more than an hour a night and I was concerned now.
I'm going to go and speak to the doctor now. Peter, I'll go and ask somebody, okay?
Cheers, thank you very much.
What I'm going to do then, swap the naproxen for a slightly different anti-inflammatory, because it's not doing you as it should do, and I'm going to increase the diazepam just so you get some relief.
Take a seat there. Let me have a quick look.
Does it look swollen? Is this one here? It doesn't look as much as it sometimes does and doesn't. This one here.
Yeah. I'm just having a look. See, the triggering occurs not in here, but it occurs down in here.
Exactly.
And it's just about there where it's happening. So there's a little nodule almost that
Can you
goes
feel it,
through
can you?
the... Yeah, you can feel that. So the injection goes in down here.
Okay. So these poppy's cortisone injections, is it something that doctors like to give out or not really, or just...
It's a treatment like anything else.
Yeah.
And it's appropriate for some people and not for others. Like anything, there is a failure rate. But I think, hopefully this will reduce the inflammation and we'll see how we do it. And if we tried a few of them and it's not effective or it's getting worse, then there's an operation that can be done. But, you don't want to go down that line if we can stop it with something else. Okay, mate?
Yeah, that's it, yeah.
Okay, a little prick now. Sorry. It's always tender. Well done. Let's pop that there.
Yeah, lovely.
Lovely. Thanks for the pain.
Exactly, yeah.
Happy days, mate.
Shall I put the money in there? Or?
Yes, please, if you wouldn't mind. Thank you very much. Thank you for your support.
Is there any stress at work at all?
No, I have been under stress.
Oh, have
because
you?
I lost my sister.
Oh, no, I'm sorry to hear that.
But I'm feeling very tired at the moment.
Is it okay if I examine you?
Yeah, that's fine.
I need to examine your tummy just to feel that, and we need to examine the back passage as well, if that's okay. It involves inserting a glove finger into the back passage, and I'll tell you what I'm doing, so it won't be anything you're not expecting.
Yeah.
Okay. Christine has a family history of bowel cancer and also presented with several months of loose motions and had some abdominal pain and weight loss, which was worrying. And where is the pain at the moment?
It goes in my belly button.
OK, so it starts up at the top and then
Yeah.
goes down. I'm just gently going to press on your tummy.
See, that's tender there.
That is, sorry. Oh, that is tender, isn't it? For the back passage examination, if you just lower down the bottom bits, I'll give you a moment to do it. Can I come through again?
Yeah.
I've got some cold gel on a gloved finger. I'm just going to have a look at the area to start with. It looks a bit sore. Sorry, can you take a deep breath? Sorry about this. Ooh, sorry. I'll let you get dressed and then come and have a seat when you're ready. There's no blood and everything inside feels normal.
Okay.
Thanks. Come and have a seat when you're ready. OK, so from examining you, you are a little bit tender still in the tummy, aren't you?
Yeah.
The back passage examination was normal, apart from it's a bit sore on the outside. The skin looks a bit red, and that might be because you've been having the diarrhoea for so long. But because you've had the weight loss and you've had a long history now, 6 months of the diarrhoea, I think it's worth referring you to get this all checked. And I think we need to do it urgently on what's called a cancer 2-week wait referral. OK? So I don't want you to be alarmed by that, but the letter will come in the post. It'll be within the next 2 weeks, and the appointment will be within the next 2 weeks as well.
Yeah, that's fine.
If there's anything abnormal on the results, I would normally contact you. If they're all OK, I wouldn't. But if you've had your appointment with the specialist and you still know better and they say everything's OK, still come back in and see us. More than 1 in 3 people will develop cancer at some point in their lifetime.
Thank you.
If it's not you directly, it will be a member of family, friends, one of your colleagues. We're all affected by it.
So where's she having her hair shaved off?
Here.
Right.
Right here.
Get the Hoover out.
It's a big shock when one of your colleagues develops cancer. And one of our colleagues at reception, Glenda, developed ovarian cancer.
When is the Great British Shave Off happening? 1 o'clock. Out here?
Yes.
Yeah.
I went shopping yesterday. I thought, I don't need shampoo.
Alison, who is our reception manager, has arranged a charity head shaving event in support of Glenda.
For a woman to actually shave their head is a big, big thing. I think so, anyway. It wasn't till the day of Alison's head shave that it hit home to me that I actually had gone through cancer. I hope I'm back soon to get you all in shape. Reception, yeah. And let's shave. Well done. Wow.
It tickles. My head feels like my old man's now.
I know, yeah, it's quite nice, isn't it?
Yeah, it is. Mwah. Proud of you.
You're welcome, my darling. The support I've received from the surgery has been very important to me. They've been in touch constantly, looking forward to having me back as a team member, and that's really been important.
In trouble. I don't come to doctors unless I need the doctors.
I stabbed it with a needle last night.
Why did you do that?
It's like I cleaned the needle first. I licked it.
I have a lady who is 24 weeks pregnant. She's got this sort of 12-hour history of right lower abdominal pain. The thing that worries me about this, though, is that it's coming with reduced fetal movements.
How are things? You're looking very young now.
No, I'm nearly dying, Italy.
I mean, the back has been a problem since 1984. I was lucky enough to be involved in a train crash.
Breasts getting larger?
Yes, they are.
Yeah. trying to beat me.
Yeah, you're not in for disappointment in this clinic.
Morning. Morning.
Hi, Barbara. Hey. How are you doing?
I'm all right, you?
Not too bad, thank you.
Good morning, final row surgery.
Elizabeth Buchan, please. Hi there, Elizabeth. Come in.
I've had a really bad back. I suffer with
Yeah.
my back quite a
Yeah.
lot. But Saturday, I started playing about with some cushions.
Yeah, yeah.
And something, just like a spasm went off in my back.
Uh-huh.
And then Sunday, it just got worse. So I went to A&E.
Uh-huh.
They said that I've got a trapped nerve.
Yeah.
I'm not able to go to work.
Yeah.
I tried to go this morning.
Uh-huh.
I've just been sick everywhere.
Right.
Really dizzy.
And are you sort of feeling dizzy just sitting still or when you move or?
All the time. I
Uh-huh.
just feel really spaced out, really tired.
What I'm going to do is I just want to have a little look in your ears, do another test, and then we'll look at your back. That's okay. Yeah, that's okay. So when you feel dizzy, do you just feel lightheaded or a bit spaced out?
I've
or?
just been sick 3 times.
Yeah. So follow my. I'm going to move my finger quite quickly,
Okay.
but what we want you to do is to follow it for me as best you can. Okay. Does any of that make you feel a bit dizzy? I can tell because your eyes are flickering when they go this way.
Okay.
Let me just have a quick look at your back then and see.
Yeah.
Logan Reed. Good morning, Logan.
Morning.
Hello. All right, what's wrong with you then?
He's had a temperature now for a few days with a little bit of a sniffle.
Yeah.
But he's started to get this cough now, so and because of all these other issues, I thought I'd just get him checked out.
Do you want to take your jacket off and let's have a listen to your chest?
He's had a temperature. It's not been sky high. It's like been 38.7.
Okay.
So it's not.
Is
massive.
epilepsy well controlled?
Yeah, it seems to be at the moment.
There we go. Listen to your back. Crystal clear.
Okay, that's good.
Okay, I suspect it's viral. Most of it is at this time of year,
Yeah.
which will cause him to have little spikes in temperature and things like this. Paracetamol, as you would normally take, regular fluids.
Okay, excellent. And one of his ears is hotter than the other one. Which one was it, Logan?
This one was
That one.
hotter than that one.
Yeah.
You wouldn't get a different temperature because of anything.
Okay.
This is not going to work. It's not been working for 2 weeks. I don't quite know why.
Battery's changing?
Maybe. I think it might be the bulb.
Yeah, maybe the bulb's gone.
Right.
Right, let's hope that it is the bulb.
Yeah.
And not the whole thing's completely blown.
Do you want to stand up for me? It needs new batteries. Yeah, right, here we go.
Yeah, normally the lump has to touch the
Yeah, so
little metal bit, but the thingamajig has to touch the thingamajig.
right. We've got a light, I think.
Oh, that's good.
Pitch your head away for me. That is absolutely normal. So maybe the other side.
Your brains haven't fallen out then, Logan.
No, that's all. There's a bit more wax on that side, but that's also normal. I think this is just a little viral cough.
Okay.
You're fine. Off you go.
Good.
Take it easy. See you later.
Thank you very much.
No worries. Bye-bye.
Now, let me just have a quick look at your back then and see.
Yeah.
Don't think this is related to your back now.
Okay.
Okay.
Yeah. The pain is right
Here, yeah, okay.
but it's going
Up here. Oh, wow. These are really tight, aren't they?
Yeah.
Okay. Can you bend even further forward or
I
no?
can bend right down.
Yeah,
and
but
it
you
feels
can't come
actually
back.
nice.
Yeah. Okay, that's good. Just sit yourself down. Okay, I'm not entirely convinced that you've got a sort of trapped nerve.
Okay.
Because normally you'll get the pain going down your leg as well.
Okay.
But also, normally sort of bending forward will make the nerve more painful.
Right, okay.
So we can give you something to help relax the spasm. Now, the dizziness and sickness, when I'm getting you to move, you're getting some flickering of the eyes. Now, that's which we call nystagmus, which just means flickering the eyes.
Yeah.
It usually means that there's possibly some fluid in the inner ear that is causing you to be dizzy and sick, because you've got a balance mechanism in there, and there's a little ball floats on some fluid. When you get more fluid in the ear, you can get more fluid in here, and the little ball doesn't respond quite as quickly as your eyes do when you move, so your brain gets 2 signals instead of 1, and it makes you feel dizzy and you can be sick.
Okay.
Now, I am going to give you something to help with that, as well as the back. Are you just taking the Cocodamol?
I've got diazepam, so I took it once, and
Yeah.
I've got a little boy,
Yeah.
it was just me and him.
Yeah.
It knocked me out.
Okay, try half now. If there's somebody around who can look after the little one, just in case it does zonk you out, that would be helpful. And keep taking your Cocodamol and the naproxen as they told you. Okay.
Thank you very much.
Okay then.
Thank you very much.
Bye-bye.
You're not busy now?
No.
You having a cup of tea?
Yeah.
A few biscuits.
Good.
Do you want to come and work here? Do you want to come and work here?
No.
Tanya Williams. Just caught my shirt. There you go. Come and have a seat down there. How you doing? All right. So, what's been happening?
I was at work yesterday.
Yeah.
I do office jobs, so
Yeah.
I'm sat down most of the time.
Yeah.
It's about 10 o'clock in the morning, and I noticed a kind of like a dull ache on, like, right underneath here.
Okay.
And I kind of thought, I'm 24 weeks pregnant, so I thought, oh, my trousers are too tight.
Yeah.
So I undone them, and I was like, oh, it'll go. Had
Okay.
my lunch. I thought I might be hungry.
Okay.
Didn't go, so I thought, okay, take some painkillers.
Okay.
The ache's still there, but
Yeah.
now what I'm getting is more like a period pain, kind of really intensified, just on my right-hand side, to the point where I was literally in tears this morning. Like, it was so painful.
Any discharge or any blood?
No blood. Discharge, I think, normal.
Have you started feeling movements yet?
Yeah, past 3 weeks or so, it's been kind of crazy.
Okay.
Feeling it kind of...
Still the same since yesterday?
Not really.
But much less than normal?
Yeah, less than normal.
Okay, fine. What I would like to do is have a quick feel of your tummy and have a quick listen if I can find the Doppler. I'll be back in a second, okay?
Thank you. It's really hurting.
See my hand, right? Sometimes that I can't bend it, the middle finger. I can lift anything, anything.
Yeah.
You know, anything.
Yes.
But trying to hold a pen,
Yes.
it's really painful.
My finger.
Look at it there, it's all white. At night time, it feels something's drawing out of it and the pain is shooting in there.
I've had this about 2 years. You know, when you go to wash up, I knock it. Oh, I can't count how many times.
Put your finger in there, Phil. Yes. Lovely nail varnish, but do you have one without nail varnish?
Yeah.
Ah,
Lost it
perfect.
this morning.
Perfect.
I even, be honest, tried to pop it, and all that came out was all gooey stuff like glue. It was really weird. I thought, oh, I'm not going to do that again.
David?
David Wallace?
Oh, sorry, yes. Hi, David. Come in. Have a seat, please. All right, how can I help you, David?
This one.
Yeah, I remember I saw you the weekend, isn't
Yes,
it?
Sunday.
Not got any better?
With that medicine, what's it called?
Yeah.
The Flucloxin.
Okay.
Mind you, I stabbed it with a needle last night to try and get rid of some of that, but
Why did you do that, David?
no, because it was filling up. Because it was like this. I need to to get rid of it.
Is it painful?
No. At first it was throbbing. Boom, boom. That throbbing is gone.
Okay.
But if you touch it or push it or whatever, then it hurts.
Okay. It looks it's got worse since I saw you.
Mm-hmm.
You should never do it by yourself because there's a risk of infection.
I cleaned the needle first. I licked it. No, I used hydrogen peroxide to clean it with.
You should never do it. I think I told
But
you.
it was getting worse, though. What can I do?
I know, you should have gone to A&E then. Or you should have come to us.
I'm here. If you've got a sharp knife, you could do it right.
No, we don't do it that.
You're not squeamish, are you?
Why?
Well, with all the stuff coming out, we could... No. Okay.
Yeah. David, I don't know how busy you are. Are you able to wait for some time in the waiting area? Because I will see if one of my colleagues can have a second look at it as well to see if we really need to send you to the hospital or if we can do it here. All right?
Yes,
okay?
fine, yeah.
All right, I'll see you soon, yeah?
Yes,
okay.
So let's have a quick feel. Do you feel it worse when you're walking?
Yes and no. I've got just a dull ache, but it's literally right there.
Sounds okay. I'll just give you some tissue. Okay, so where you're tender when I'm examining you, it seems more likely to be like a ligament strain. But the way you describe it doesn't quite fit, especially because you haven't been feeling the movements as much. Just do your blood pressure first and just make sure everything's all right from that point of view as well. Let's turn around. All right. Oh, hi there. Could you put me through to maternity triage, please? So I have a lady who is 24 weeks pregnant at the moment. It's her second pregnancy. She had preeclampsia in her first. So she's got this sort of 12-hour history of right lower abdominal pain, and her blood pressure and things are all okay. The thing that worries me about this, though, is that it's coming with reduced fetal movements. But her fetal heart sounds are about 130 when I listen, so it sounds more reassuring. Does she need to come in for a CTG with yourselves, or what do you think? Okay, fine. All right, that sounds good. Thank you. Cheers. Bye. Okay, so what they've said is they want you to take two tablets of paracetamol and call them in 2 hours if you think things are not settling. Okay. If it is settling, it's probably just the ligament pain, and they're less worried about the fetal movements. Yeah. So, okay, so I'm just going to write it up in your notes. Okay, so 2 hours' time, if you're thinking I'm not heading in the right direction, I want you to call that number there. Yeah. Tell them that this was the plan that we've made, and we'll see how we go from there.
Cool. Thank you
Hopefully,
very much.
it will settle. No problem. Take care.
Cheers.
Okay.
Cheers.
Thanks a lot. See you then.
Bye-bye. Bye. Oh, look at you in that coat.
He's a cutie.
Do you feel better now?
Yeah, he's much better. He was really bad, so the doctor was worried about it. But...
There we
Put
go.
your foot
down. There we go.
Good smile.
Yes. We're going to numb it by putting anaesthetic in your finger, and then as soon as it's numb, we're just going to stick a knife in there. Is that okay? And hopefully that'll make you feel a lot better.
Thank you very much.
It's on the left hand middle finger.
I love your shoes. I really like them. I've been looking at them as you've been walking up and down the stairs. They're nice. Quite a well-dressed, and I believe you're a runner in your spare time.
No, I'm a cyclist.
A which?
Cyclist.
Okay.
That's disappointing. Yeah? Are you a runner?
Yes.
See, I tried to let you down. Yeah. I'll sit you over here. Mm-hmm. Is that okay? So, and put your hand on there so it's comfortable. That's it. Yeah. Okay. You ready?
Yeah.
Just look away. Okay.
Oh, that was okay.
It was okay?
Yeah.
That should be the worst bit. Should be.
Does the sight of blood bother you?
No. Are you okay?
Yes, thank you.
Yeah. Don't look at it.
Can I look at you instead?
If that helps you, that's fine.
How's your finger feel?
No.
Okay, if you mind just lift your finger up for me. Put your finger down. Okay. One more look away. How does that feel?
I can't feel anything.
Okay. No. All right, so that's how it looks now.
Mm-hmm.
Letting the pus out should let everything else settle down.
Not much came out.
There's never as much as you think. It's always disappointing. You always think you're going to be going under the stuff.
I thought it would be.
Yeah, you hope, yeah.
A little fountain.
So this is the most challenging bit for the doctors, is, of course, we're rubbish at dressings, and the nurses are fantastic.
Oh, well.
Okay, so...
Is that why you're not a nurse, then?
That's why I'm not a nurse, yes. I had to set up to be a GP because I couldn't do the dressing, yes.
I can put... Oh, can you close that door, please?
Hello. Come on in and have a seat.
Morning, Dr. Bolger. Morning.
How can I help you this morning?
First thing is, I've had very, very dry ears for
Oh, you have, haven't you?
3 months.
Have we tried anything?
Well, we tried Vaseline, a nurse recommended.
E45, and we've been trying them on coconut oil.
Coconut oil, OK. Very inflamed, very angry. I think maybe a touch of some steroids might help with that, some hydrocortisone. It may well be that that makes it much better, and then you can just carry on with the E45 until it goes. If it makes no difference at all after a fortnight on the steroid cream, can you come back and let one of us have a look?
Yeah.
Yeah.
OK.
The second thing is, do you remember we had this big discussion about why I was on testosterone?
No, I don't remember. Remind me.
He was having injections regularly, and then we were told that something had changed and we had to see Dr. Juanji.
Who's the urologist?
Yes. It was Dr. Juanji that stopped it. I can't remember now.
So why was it for?
I suddenly was getting very, very sore nipples, and I was scratching them. In the end, I was making them bleed. It's come back now, actually.
Low testosterone can cause a variety of symptoms. It can cause problems with sex drive and with sexual function, fatigue, weight gain, problems with hair loss, and it can cause mood disturbance and also sometimes sleep disturbance. Low testosterone isn't generally thought to be a symptom of more serious conditions, and it's recognised that testosterone levels do tend to fall generally in most men from middle age onwards.
And did you have blood tests that showed low testosterone levels?
I must have.
Yeah, I think you did, didn't you, at the time?
Right, OK. Is there anything to see at the moment? Is there any inflammation or redness?
There's only a slight bit of redness, and that's probably been me scratching.
Scratching. Breasts getting larger?
Yes, they are.
Yeah.
They are?
Yeah.
Right.
He's trying to beat me.
There's no answer to that.
No competition.
Can I have a look?
Yeah, sure.
Right, it'd be worth checking your levels. That's all fine. There's no untoward lumps or bumps there. That's good. Testosterone is sometimes given by urologists, and I suspect that when we were a bit nonplussed about why you were taking it, that's why you saw Dr. Juanji. We have the electronic records, obviously. It might be that actually we need to get your records up from out of storage to have a look if it were letters from then.
That should break the porter's back.
I'll need a wheelbarrow just for yours.
Yeah, just for his.
If we start with some blood tests, and then when they come back, maybe if we say we'll meet in a couple of weeks' time, it'll give me time to have a look through. And then I think if your testosterone level is low, then it might well be worth thinking about asking an endocrinologist to see you and giving us some advice.
OK, lovely.
And obviously when I see you in 2 to 3 weeks' time, you can show me your ears as well.
Lovely, thank you very much.
I look forward to that.
Do you think it'll make him hear any better?
Bye-bye.
Thank you, Dr. Bolger. Come on, we've got to go make a blood test for you now.
Do tomorrow morning. No?
Yeah.
8:42 or 8:44 or 8:48.
8:48, what? That'll be spot on. What? Yeah.
Which one would you like?
I'll have 8:48.
Or you can have 8:58.
That one. Then that way I ain't got to take it to school.
OK, that's booked for you then for tomorrow at 9:58.
9:58.
8:58, sorry.
I've got to say, you cuckoo there.
It's the computers, they frazzle your brain after a while.
I'll be about just before 9 then.
Yeah.
Well done. See you tomorrow. See ya.
Bye.
Serena Martinez. So how can I help today?
Pain I'm going through has been, I don't know what caused it in the beginning. I've always said it's the medication. It's what, my whole body's just gone weak, and it's like every time I'm concentrating on something, I have auras. So I can't even sit down and watch telly too long.
What have you come for today?
Because of the seizures are ongoing, they haven't stopped since them what they call clusters.
Yeah.
She's having pain in her chest.
Pain, yeah, in the back.
She can't breathe properly.
And you got an outpatient appointment on?
Yeah, but waiting, I don't feel like I can flipping do that. It's pain in my gut. Something, it feels like something's in there and it's getting bigger and bigger, but it doesn't want to come out the rear end. Doesn't want to come out my mouth. I'm burping sometimes, but it's like me forcing myself to burp. I wouldn't be here if I wasn't in trouble. I don't come to doctors unless I need the doctor.
What's the symptom you're worried about most, Serena?
Going to the toilet, I can't get anything out.
You're constipated?
Yes, and there's nothing in me.
Because she's not eating.
It's been like this for the week. So when I had the 9 seizures, and I've been trying to eat. Once I put something in my mouth, I'm going into a seizure. That's not normal. It hurts when I cry. I'm sorry to swear. I can't handle it. I can't handle this anymore.
My eyes are driving me mad. So there's some irritation somewhere.
Something's irritating you, obviously.
Yeah.
I was going to ask for some of them little blue pills, but you...
Mrs. Morley has a nursing background.
Tell me about it.
So it's good to have a nurse doubled up as wife.
I love you.
I love you too, baby.
You're both off. That's nice to have a day together, yeah?
Sometimes, yeah.
You didn't hear that.
I don't know what's going on.
Have you had any change in your medication for your epilepsy in the last 2 weeks?
They gave me lorazepam when I went into hospital and I was meant to be on clobazam.
The lorazepam you're just not taking?
No. I stopped that, I think, yesterday.
And you're stopping taking because you just don't like taking it?
No, because of the feelings it was giving me, it wasn't helping.
Would you rather have some clobazam
I'm thinking yes, because
in
how
reserve?
it made me feel.
In reserve, in case you have a seizure?
Yeah.
Because when you used to take it, you used to be all right.
Yeah, it used to
You know,
knock me out or just relax me.
But these are not to take on a regular basis. These are to take as and when, yeah? Have you heard from Chalfont?
He just rang me just now, said he's looking, he's going to get me in ASAP.
I think what's clear is that you need to see the Chalfont consultant, because I think there's some confusion here about what actually is the medication you need for your epilepsy. There may be a bug in your stomach that's creating a lot of acid.
I think so, because something's happening. I'm not eating properly.
I want you to have blood tests, okay? Okay, which you'll have to make an appointment for Monday morning to have the blood test here, because the person doing the blood test is now not in the building. The problem with the tablet that we could use, it can interact with some of your other tablets. The complication at the moment, Serena, is there's a lot going on here, and as a consequence, you're getting an anxiety reaction to all of it as well. It's understandable, but you've got to try to find a way of keeping calm.
Can I just stand up?
Part of your problem is you're getting in a cycle of anxiety about all of your symptoms.
I'm not getting no answers.
There is, I know, I am conscious of the fact that there is a lack of clarity about your epilepsy management and that the seizures actually are the most important presenting problem today. Let's get those results back. Let's get you seen at the Chalfont. Let's have you take this away today so that if you have seizures, you know you have confidence in the fact that you have something to take. And then we'll see you again next week. Take this.
There's nothing they can do. It's not them then.
Take it easy.
Yeah, thank you.
Cheers.
Go to sleep. I was tired this morning though, like I woke up and I literally couldn't open my eyes.
How can I help?
I'm here for my 6-week check.
Your baby's 6 to 8 weeks?
She'll be 2 months tomorrow, yeah.
Okay. And was it normal delivery?
Yeah.
Yeah. How did it go?
Yeah, no, it all went smoothly.
You did well.
Yeah.
So any problems since you had the baby?
No, other than nothing
like physically, but like I don't know. Sometimes I just feel a bit upset or whatever, or down. Sometimes I feel like I can't really not look after them. I don't know. I just sort of I'm not myself, if that makes sense. I just feel a bit upset at things and.
Is that happening every day?
Maybe not every day, but like most days, maybe.
How much is it bothering you?
Well, me and my husband sometimes we might end up having an argument or whatever, and then I feel really upset. Like I got quite upset this morning, but.
And is it an argument over practicalities?
It's over really simple things, to be honest. And I don't know if that's because we're both tired or if it's because I think he thinks I'm a bit more upset than normal.
I mean, if your sleep's not affected and your appetite's okay, then I think for the time being we can just see how things go. If it starts to become quite all-consuming and, you know, occurring on most days for a lot of the day, then come and have another chat about it, because it might be that you're getting a bit of postnatal depression. That can manifest itself in lots of different ways. It can be that you feel more tearful. It can be that you feel much more tired.
It has been a little while, but I haven't ever come in because I always thought, oh, it'll go soon. Yeah, I don't know.
Come in and take a seat.
Thank you.
Right, what can I do for you?
Well, unfortunately, my back has reared its ugly head again. And this time, I managed to escape from the ambulance service.
Oh, did you?
Yes, I'm working as an endoscopy technician.
Right.
Very keen to actually do the job.
Yeah.
Until I actually got there and started doing it.
And then, do you think that's making your pain worse?
Yeah, because it's washing scopes in a sink that is very low.
Okay. So at the moment, what's the back doing?
Sharp pinching pain around the actual spine area.
Yeah. Any radiation anywhere else?
I did have an injury at the South Central Ambulance Service, and it's on the right-hand side around
into the buttock. Okay, into the hip. Okay. No incontinence?
No.
No? Okay, no numbness, pins and needles anywhere?
No.
No, okay. Come and have a lie up here. So how long has the back been a problem for altogether, would you say?
Well, I've been managing it quite happily, even with lifting and carrying patients with the ambulance service.
Yeah.
I mean, the back has been a problem since 1984.
Okay.
And I was lucky enough to be involved in a train crash.
Oh, no. Where was that?
Would you believe it's not been documented? I can't find it. But it was the first fast train going into Paddington. And it tried going in at 100 miles an hour.
Wow.
Yeah.
Okay. Right, could you lift that up straight for me? How far can you go?
About there.
Okay, and that makes the pain worse when you go any further than that? Okay. Have a sit up for me slowly. Okay, if you can spin around this way so you're still sitting on the bed. Okay, if you pop your hands behind your back and just slowly come forward for me. So, down. I'm just going to move that leg up. How far can you go with that?
Just there, basically.
Okay. Up. You can pop those trousers back on again now. Okay, I think you need, well, a couple of things. What medication are you taking at the moment? Anything?
At the moment, I'm constantly taking paracetamol and ibuprofen.
Yeah. I might give you some paracetamol with codeine at the moment.
Just continue exercises.
I think you need to continue the exercises.
I can't actually stop moving because then I'll seize up.
Absolutely. But the underlying problem will still be there, and also the work-based problem will still be there as well.
Right.
And that needs to be sorted, doesn't it, really?
It does, yes.
Either by a new job or by them suddenly finding money to put a new sink in or a change so that you don't do that thing. And, you know, I'd be more than happy to say, yes, you can do the job, but you can't wash endoscopes in a low sink.
Mm.
And I can put that on a note to say, could be fit for work as long as an adjustment in duties.
All right, lovely.
Good.
Thank you very much.
OK, mate. Take care.
Thank you, I'll try.
Watch out for fast-moving trains.
Yes.
See you later. Bye-bye.
Had you got to the stage where you thought you might need some help with some medication or some therapy, or is it?
Yeah, no, I always thought maybe talking to somebody. I don't know if that would.
Well, you can refer yourself to something called Healthy Minds,
Okay.
And they can arrange for you to have some help.
Yeah.
If you feel that that's not enough, or you need a bit more help, then you can always come back in and see us here. There's no one out there scoring you for being the best mum in the world. There's no real right and wrong. You just got to be happy with how you're doing.
Yeah.
It's hard. It's very hard, especially with two.
That's very good.
And are you ever feeling it totally overwhelmed, or do you ever feel like self-harming? Or
No.
So, are you happy with that? Are you happy to have a chat and see with Healthy Minds and see if they can offer some therapy?
Yeah.
So see how you go then. If you have any problems, just come back. That sort of thing. Okay.
Well, thank you very much.
All right, thank you.
Hello, how are you? Oh, thank you. It wasn't required though. How are things? You're looking very young now.
No, I've been nearly died in Italy.
Did you?
3 friends, 2 o'clock, we went have a snack in my apartment. We drink 3 liters wine, but only a couple of glass. And my friend said to me, can you take this glass to the kitchen? You believe it? I went on the floor, I broke the glasses, I never cut myself. He said to me, I went dead. I said, why didn't you call the doctor? Why didn't you call my wife? I thought you drink too much. What do you mean I drink like you?
Okay.
I think my heart.
Take care.
My heart, I think, felt bad.
I think we need to do a thorough check of your heart today then. Yeah. I'm just going to quickly listen to your heart now. The heart is beating regularly, around 60 beats per minute, yeah? Just take some nice deep breaths. In and out, in and out. That's good. Thank you.
Maybe I need operation, no?
I don't think so. I'm a bit unsure whether it's related to alcohol, whether it's related to the pacemaker. But what we can do is organize a heart scan to look at the latest functioning of the lower chambers of the heart.
I give a bottle to the girls. You know the girls?
Yes.
I bring the bottle of wine too.
Oh, did you? They'll be very happy.
This is my picture. Look.
That tastes really good. My wife says that. So blood test, echo scan, continue the current medications, and we'll meet back in 4 weeks' time.
I make wine now. I've been very busy for 2 weeks.
How are you? Make sure you drink in moderation because the warfarin interacts with alcohol. So when I say moderation, in your situation, just a glass.
If I drink wine Guinness, I tell you, doctor, I don't drink wine.
Do you drink daily?
No.
No. Okay.
Only water.
Okay, that's good. Keep updated.
I used to drink that.
Take care.
See you.
Bye-bye.
Thank you.
Yeah, you're not in for disappointment in this clinic.
I'm hungry.
I am as well.
We had soup.
Yeah, that's all I had. God, I'm always hungry as well.
Mind you, yesterday, I don't know what I was doing, but every time I was walking out that way, I felt as if I was losing my trousers.
Oh, God, really? That's good, isn't it?
It is good. It means I'm losing maybe an inch or half an inch or a fraction even.
Yeah, why not?
Susan Dorel. Here goes. Hello. Hi, come on in. So I've got Claudette, who's here to help you and me.
Oh, I am terrified.
Oh, please don't be.
Well, what happened the last time? I couldn't sit down for a week.
Really?
Yeah. Really.
Okay. Okay.
And the other thing I was going to ask you, someone close to me has just had a breast cancer scare, and she yelled at me and said, "You must check your breast." Well, I've never done it, and I don't know how to do it. So I just wondered whether you could show me how to do it as well.
Okay. So I can check your breast today, and then what it is it's more about being breast aware. So I'll show you how you can check it yourself. I just need to have a quick look at the cervix so that I can do a smear. It may be a little uncomfortable, but if at any point it's actually hurting you, then I'm not looking at your face, so you need to tell me to stop, and I will stop. You're the boss here, okay? This is not a torture chamber, so you are guiding me, okay?
Not
All
a
right.
torture chamber, she says.
It's quite worrying that 1 in 4 women do not attend for their cervical screening tests, more popularly known as the smear test. In spite of a well-organized national cervical screening program, about 800 women die each year from cervical cancer. Cervical cancer is an extremely preventable disease. In fact, it's probably one of the most preventable cancers. So my plea to all you women out there who are due a smear test is to ask you to put your fear and embarrassment aside. It could save your life.
Things us women have to go through.
I know, I know.
I am terrified.
Are you going to be a brave boy? If you're a brave boy, I'll give you a choice of some stickers if you like.
Okay, try and relax. Well done. You're braver than you think.
That's it, put it over. Oh, you're very brave, aren't you? You're like Superman.
Oh, brave, Daddy. All done.
He's very brave, Doctor.
You're very brave, good.
I've had surgery this year.
Oh, have you?
Kind of sailed through it flying colours,
Excellent.
actually. Anyway, I'm a brave soldier, so.
Oh, good.
You were so brave, huh?
So if you relax like you did, you're very good. Okay. It's really, you're very cooperative, to be honest.
A friend of mine said that you don't have to have them if you're not sexually active. Is that true?
Have you never been sexually active?
Well, I've had the odd boyfriend.
Then it's worth having it. Okay, so
Well done, Susan.
I've done the smear.
Wow.
Okay.
Really?
Yeah, okay. So I could see the cervix looks normal. So you wanted me to check your breast
Yeah.
side, didn't you?
Yes.
Do you want to come in, Claudia? All right. Yeah. You've never had any breast lumps or anything
No,
like that?
no.
Okay, and the way to feel it is with the flat of your hand.
Right,
Okay. Perhaps, once a week or once a month, whenever you get the time, you can stand in front of the mirror, look at your breast, see if there's any asymmetry, is one sort of a nipple looking a bit different, any discharge from the nipple. Okay, sit up for me. And if you feel any lump at any time, at the moment, there's nothing to worry about at all. Okay? And take a seat.
That is such a relief.
So what happens now is that you get the result, and if you get the letter and you're worried and you want to speak to me, then give me a call and I'll call you back.
Thank you ever so much for your help.
Pleasure. I'm glad we could help.
I'm so glad that it went all right. Thank you very much.
Pleasure.
Okay. Thanks very much.
All right.
Bye, Susan. Thank you very much.
All right, take care. Bye.
I was doing this to my head, right?
You got a headache?
Yeah, I've gone really bad. These
Hug a
lights
doctor.
are horrible.
Hug a doctor.
Hug
I
a
did.
doctor.
Yeah, because they said on the television, instead of keep taking paracetamols or something like that, it says hug a doctor. So just hugging is a form of calming down, I think.
Oh, give us a hug.
But I'm not a doctor.
Oh, it's gone?
Yeah, right.
Hello. Hi, how are you?
We're not well. No, see, we're not well.
We're not well.
No, we're not well.
In what way are we not well, Malachi?
He's got a rotten cough.
Yeah, since when? When did that start?
About 3 days now.
Yeah. Mm-hmm.
He's not eating very well,
Yeah.
and he's not drinking very well either.
Okay.
But we still have had some wet nappies, so I'm not too concerned.
Yeah. Is he running round?
Apparently not.
I think this is his stock answer to every question. You shake his head.
One
I'm just going to take
minute.
your temperature, Malachi. It's okay.
Good.
Can we pull this Batman up? So tell me, is it true that you are actually Batman? Or are you just wearing? I can hear your chest pedal when you scream, you see. I can. Yeah, good.
No, you're done.
We're all
You're done.
finished. All
It's
finished.
all right. It's all right.
Yeah, so he's got a very mild viral pharyngitis. It's a slight viral infection of his throat. His chest is really good. He's obviously got the same virus in his nose. Ears normal, neck normal.
Can't we just take all the bugs out of my baby?
He needs those bugs to strengthen his immune system so he doesn't come down with important diseases.
He doesn't need an immune system. I'll stick him in a bubble. It's fine.
Oh, I see. OK. So all you've got to do, give him something like Calpol. It's going to kind of feel like this still. Same symptoms about another 48 hours. They begin to disappear at that stage. But, of course, they could come back.
No, we don't want them to come back. We want positive things, please.
Well, do you want the truth or do you want fiction?
No, we want facts.
Yeah, well, facts.
Bit of fiction at the end, though,
yeah? Hopefully it won't be fiction.
Rhetorical question at the end.
Oh, very good. I'm very impressed. I'm very impressed.
And a tip.
What's your top tip for today? Have you got a top tip?
To brush your teeth.
I do.
Yes, that's very good. They're really important. So important for your health to brush your teeth every day. Top tip for health. When you're feeling cold and unwell, honey, lemon, cloves, whiskey and hot water.
The one home remedy that really seems to work is that when you're feeling very sick, leave some lemonade to go flat and then sipping it slowly really helps settle your stomach.
If you've got a lot of trapped wind, peppermint's very good.
It's the cleanest it's been.
Is it? Honey is really good, you know.
Good morning, sir. The weirdest tip I was given from a farmer who said that he put a rasher of back bacon in each of his socks to treat his hard feet.
When my mother was alive, she says, going into the sea with your feet is the healthiest thing you could ever do.
OK. One top tip my mum always used to give me was turmeric, ground down and mixed in with warm milk. And she swore that it was the remedy for any ailment that I had. Have you heard the expression that we've got? You should put nothing smaller than your elbow. Yeah. No, in your ears, yeah? No, sorry, nothing bigger than your elbow. They're not smaller. Yeah. So you should, in other words, you shouldn't put anything in your ears.
People underestimate the importance of getting involved in their community. It keeps you healthy, it keeps you positive, keeps you well, wards off loneliness, wards off depression and anxiety. Bye-bye, Malachi.
I'm sorry. Thank you for entertaining my thug.
You're more than welcome.
Thank you, Doctor.
You take care. Bye-bye.
Bye-bye.
Bye-bye. So sweet.
That's it, finished. I'm done.
Very good. I'll see you later.
Thank you very much. Bye-bye.
Good morning, Holford Health Centre. Sally speaking.
But for over a year now, the batters have forced the doctors to hospitals for x-rays. There's got to be something wrong. It can't just be nothing.
I don't know what it is. I seem to be waking up on a morning as if I'm drugged.
I've noticed this morning her nose was bleeding. You can see.
Terrible snoring, you can keep you up at night.
Does he actually stop breathing in his sleep?
Oh, yes, he has stopped.
When I get really anxious and I start cleaning.
Right.
So I was up to about 3 this morning cleaning.
Hello, Spinal.
Hello, you okay?
You had a happy day already, have we?
Oh, yeah, have you? Exactly. It's always a happy day.
I thought that was all Disney stuff.
Fairy tale.
Okay, hello there. Do come in.
Thank you.
All right, you're looking a bit uncomfortable there?
Yeah.
Come and have a seat.
I had a gentleman go inside of the car on Friday, so we went up to A&E.
Okay.
And they were like, yeah, just keep an eye on it.
Yeah.
And if no better, go back to doctors. And it's not, I just want something to put my head up, if that makes sense.
Yeah.
I get a shooting pain, sometimes just going across, but also across my back, about there. And it's like, I just want some relief, really.
Okay. So were you driving?
I was driving. There was a car parked across bays that way, and we were driving that way. We almost got past him, and he just didn't see us.
Oh, I see. You were going that way, and he pulled out into you.
Yeah.
So on the passenger side. Okay.
Yeah.
What sort of speed was it?
Maybe going 10 at a push.
And at the time, did you think you'd been injured?
It was a bit of shock. I got out of the car and it was like, "Did you not see me?" And he was like, "No, I didn't, love." Went to Sainsbury's and I thought, oh, my neck started to smart a bit.
Yeah, okay.
So went up to A&E.
Okay, you're wearing a seatbelt.
Yeah,
You had a neck restraint on.
Well, the headrest is there, but I'm small, so it's sort of... I'm in the space.
Adjustable, you know.
I know, but I'm in that... It's not quite the bottom, but do you know what I mean, don't you, Teak?
She needs like a half rung in between.
Yeah, and then...
I see.
Yeah, so it's that, do I need a booster seat? Don't I need a booster seat? It's one of those sort of things.
All right, okay. Okay, just swing around your chest like that. I just want to check your arms and your hands first of all, actually. Do you just show me your hands like that?
Yeah.
Okay, don't let me push them together.
I've got arthritis now.
Okay. Yeah. Squeeze my finger tight as you can. Down. Don't let me lift your hand up. Sorry about that. All right.
How are things going?
Oh dear, well, during winter, when it's really cold, my fingers tend to be really, really pale. But lately, if it even rains and it's a bit chilly, it tends to be numb. Yeah.
Do you get change of colour with it when it does that?
Yes.
It goes
so
white.
Really,
does it go
really
blue
white.
and
No,
purple
it's
later?
just white.
Just white.
And
just on the
sometimes-
tips of all your fingers,
Yes.
because they feel cool to me now.
Yeah, and
it's painful.
Yeah, it's really painful.
And it's worse when it's cold and rainy and
That is it.
winter.
Yes. I don't know what's wrong with me.
Do you know what that you don't know? Because I'm sure that the diagnosis is Raynaud syndrome.
Oh.
Have you heard of that before?
No.
Well, it's a common problem affecting around 5% of women. But it's the spasm of the blood vessels as they supply the tips of your fingers, and it's set off by the cold. And it makes them go white, and it makes them be painful, and it's basically everything that you're describing.
Yes, it does happen. I was like, it's something wrong
Shall I
with
write?
me.
I'm going to write down
and I can have a read about it myself.
Go and have a read, because
Yeah.
you'll see. And there isn't a magic fix, though you can try gloves and keeping your hands warm and things like that, and you can try some medication for it if it gets really bad. Go and have a read about the treatment.
Okay, I will surely do. Oh, dear.
Occasionally, it can be linked to other more generalised illnesses. So if you read up on there, it will tell you what those are. They're much rarer, but they would need another blood test if you had some of these other, kind of symptoms or problems, swallowing problems, generalised joint pain.
Okay.
But if it's not doing that and it's just isolated Raynaud's, then it doesn't need us to do lots of other tests at this stage, unless it gets really bad, in which case we'll see you again.
Okay, I'll read about it.
And then let me know.
I shall let you know. Oh, God. I think you have
Fingers
to see me
crossed,
all the
Janet.
time. I hope you're not tired of seeing me.
No, it's absolutely fine.
Do you mind if I
Don't
check my weight on the...
No, that's fine.
Are you
You'll need to tap on it just to turn the scales on.
after I left here, I've been really working hard.
Great. Well, fingers crossed then.
Fingers crossed. So hopefully, let's make 72.
How's that?
That's good because that time it's 72.6. It was 74 the last time I came.
Well, there you go.
So I think it's paid off.
Yeah,
Thank you
well
very much,
done.
Dr.
Nice to
Penny.
see you. Bye.
Okay, just turn your head slightly that way.
Yeah.
That's hurting. You've got to say when it hurts, Mum.
I'm sorry.
Yeah, say out, because I can't see you very well.
Sorry.
Okay, so if I turn it that way.
That's a bit sore there.
Okay, if I turn it the other way.
Sore there.
Okay, but it feels like it's moving reasonably.
Yeah.
Actually, you can hold your head in neutral. It's more comfortable to move it that way.
I just need something like a constant pillow would be lovely, but I can't seem to find one.
Had you tried making your own?
I mean, I put the rabbit that I have in my bag underneath, and that's quite nice because
Yeah,
it's
feels
squidgy.
lovely.
Yeah, that looks like good medical device, isn't
Yeah,
it?
I thought so. It's just, I just need something soft.
OK. Just to say what's happened here, I mean, this is a common thing. If people are in a road traffic accident, often you get a little bit of jarring in the muscles and it can be surprisingly uncomfortable for a day or so.
That's what they said,
Maybe even a week or so sometimes, but I don't think it's going to be that long with you. And I don't think there's anything serious damaged here, and I think everything's going to come right. It's sometimes helpful to have an anti-inflammatory gel to rub into the muscles.
I've still got some from before. Am I allowed to use it?
Yes, certainly use that 3 or 4 times a day, actually.
Okay.
That'd be fine. We can't prescribe you a neck collar, and actually we really wouldn't want to.
As stupid as it sounds, I do have a collection of teddy bears. I might just try one of those.
OK, teddy bear therapy.
That'd
be good.
There you go.
OK, and then I'll give you a sheet with some neck exercises.
Lovely, thank you.
All right?
Yeah, maybe you could sell them in a little sort of shop on the side.
Oh, yeah, we could do that. Everyone needs a teddy bear or two.
You'd buy them all.
I would buy them all.
There we go. Jolly good.
Thank you. Thank you very much.
OK. OK, now I hope the car gets better soon.
Oh, the car's getting taken away.
Monday.
It's going to be fixed.
Okay.
Thank
Jolly good.
you.
Bye-bye.
Bye.
Hello, I'm liking the wheels.
Yeah.
I tell you what, can I swap? This is killing me, this.
No,
Christopher Collins, please.
Sorry, I couldn't do much. I've been doing it all night, this.
And then you struggled, not to worry, coming in.
So when you've got to go, you can't go. When you don't want to go, you go a lot.
Have a seat.
I've been terrible all night, I tell you.
Oh, dear. So tell me what's been happening.
Basically, it started in the afternoon, about 3. I was weeing. I couldn't control my urine, and throughout the night from the evenings, it was doing it all the time. Like, you know.
Right. Okay.
I weed this morning at about 9, and a lot came out.
Okay.
I actually weed into a bucket in my room because I couldn't make it to the
Oh,
toilet.
dear. Should we have a little listen? Where does this go? Yeah, fantastic.
Take nice deep breaths through the open mouth.
Can you say 99 for me?
99.
And again?
99.
And again?
99.
Nice deep breaths. Oh, there's some serious static going on.
Nice.
Morning. You have to sit on this one because it's you that's here.
Hi.
She woke up this morning and her heart was racing, like I did like her pulse and things. And then she was led in bed. She was literally just led in my bed and she was like that. She was breathing really fast.
She was kind of panting.
Yeah, as if she'd just been running. And then she had a really bad cough yesterday, didn't you?
Yeah.
Stay here because he's got to see you.
So yesterday she was coughing.
Coughing a lot. She's normally quite happy, walking around and running around. And then all of a sudden, she'll just want to lay down for half an hour.
She had any temperatures at all?
Although she didn't have a temperature, she was sweating, but she was, like, not hot to touch. So I was like, that's not normal.
And was that at the same time as she was
Yeah.
breathing more quickly? All right, Karina,
I'm 35.
do you think you could come and sit on this chair? What a start. Right, have you seen one of these before? This is called the stethoscope.
It's magic.
I'm going to listen to your heart to start with, which is there. And it is beating.
Shh. He's got to listen to Sissy.
And it's beating nice and regularly at a normal speed
Yeah.
at the moment.
Okay.
Now I'm going to have a listen at the back.
Let's go in now.
So both our heart and our lungs sound completely
You're
normal.
supposed to breathe, Riff.
Let's see what your temperature is now.
Freeze.
So temperature's 36.6.
That's good.
Which is good.
That's what we want.
Yeah. Right, now I want to have a look in your mouth. So I need you to open really wide for me. Can you open a bit wider?
Open as wide as you can.
Don't puke.
Does it feel sore at all in there?
Does it hurt?
Shh, let her listen to the doctor.
Looks a little bit red.
Okay.
And I can feel some little glands enlarged in her neck. OK, we're all finished there. You can go back to playing if you'd like. So I think the first thing to say is I don't think there's anything too serious going on. I think probably she is brewing an infection, which explains a lot of the symptoms, and it's here upwards rather than there downwards. Throat looks a bit red. Her breathing going a bit quicker, coinciding with perhaps having a temperature. I think those two things often go hand in hand. Fast breathing or panting, if that's on a sustained basis, if it's not getting better quite quickly, is definitely one of those things that we do take quite seriously because it can be a sign of more serious infection.
Yeah. Really?
OK.
We're finished now.
Wait.
Take care, guys.
We can go now. Say bye. Say thank you. 3, 2.
Am I getting better at cartwheels?
Yeah, please stop. Big pull. Oh. Thank you. Be back for a broken leg
Yeah, no, I was
later.
just thinking that. See you soon. Bye.
Good girl.
If you pop up on the bed, can I have a little feel of your tummy? And are you drinking OK?
Yeah.
Yeah. OK. OK, can I have a little feel of your tummy?
Yeah.
Yeah.
Did you do the bathroom?
Are you not able to? There we go. OK. Have you got any pain there at the moment?
No.
No, I'll just have a little gentle feel around, OK?
OK.
That's fine. You can pop your stuff back on. Do you want me to do the button again?
Please, yeah.
There we go. So you just do your zip, OK? And get up when you're ready. OK, so this is showing a lot of white cells, some blood and some protein, so that is probably a urine infection. So it's really important to drink as much fluid as you can. Take paracetamol if you get any pains or fevers.
Okay.
Is that OK?
Yeah.
Antibiotics, 1 twice a day for a week.
Okay.
We're treating it as a urine infection, but it's a little bit more unusual to have a urine infection in men, so that's where it's really important for you to come back next week and check that everything's resolved, all right? In fact, if I give you another urine pot to come back with next week, bear with me, I'm just going to get one, all right?
OK.
As a urinary tract infection in men is more difficult to get, we do worry, could there be something more underlying? Things we'd worry about are blockages or any potential cancer in the bladder. This was the first time I'd met Mr. Collins because he's not my registered patient. I could tell that he suffers with a mental health illness. I can see this from his notes. UTIs and other infections can cause confusion and can make mental health symptoms worse.
This is the truth. I'm possessed, not by demons, but a state of telepathic communication. Others may try to use it.
There we go. So if you do another urine sample and bring it back with you when you come next week.
OK.
All right, there
Thanks
we go.
very much.
So take that to the desk and they'll book that appointment for you.
OK, thank you.
OK, let me get the door.
Cheers.
OK, all the best.
All right, bye.
Bye-bye.
Oh, sorry.
Just had a spillage.
OK, what can I do for you?
Open your mouth for doctor, please. Can you see his tonsils?
I can't from here, but I'll have a look in a minute.
OK,
yeah,
they
so
are huge.
tonsils remain huge.
And terrible snoring. You can keep you up at night.
So that was the next thing I was going to come
I
on to.
can keep anybody up at night. The other
Can
thing,
you?
Yeah.
Are you a great snorer? Can you do an impression of your snoring? You're a great snorer. Fantastic.
sometimes when he's really tired, he'll get to a point where you think he stopped breathing. He'll go in,
Yeah, well, I was going to ask you about that. So this is at night, you mean?
Yeah,
Right? In at
yeah.
night, yeah.
So he'll go in, and you think, oh my goodness.
Can you do an impression?
So he'll
of
do.
it?
And you're thinking, when's it going to come out? And then he'll just go.
Okay. Does he actually stop breathing in his sleep?
There's been nights when I've actually checked on him thinking, what's happened?
Yes.
So yes, he has stopped.
All righty. Can we have a look at you?
And certain things seem to bother him. Certain types of music, not all types.
Okay. Well, I have that
with
problem,
like a
but
heavy
yes.
sort of bass.
Yes, okay.
Can't take it.
Did you hear that Mummy was saying?
No.
So sometimes when you listen to music, you find it a bit difficult. Are you aware of that?
He dances to the music at home.
Does he?
Random crazy.
Okay, tip your head back slightly. Let's have a look at these amazing tonsils that Mum's been talking about. Good lad. You're absolutely amazing, aren't you? I mean, I think this lad should be seen by ENT. He has got large tonsils. They're not the largest I've seen by some way, but they're quite large enough. So, yeah, it all ties in together. He is, in an old-fashioned parlance, what we call a coryzal child, a child who's got big tonsils, got big adenoids, got slightly nasal sort of speech with it, and it's a syndrome that goes together. And I think ENT should be seeing him and deciding whether his tonsils and adenoids need to be removed.
Okay.
Is that all right?
Yeah, perfect.
Yeah. Okay.
Anya.
We'll see how it goes. All right, but I will get a referral letter off.
That's brilliant.
Okay, cheerio then.
Thank you.
Bye, Faye. Bye-bye.
Bye. Right, come on then. Home.
Oh. I'll have to take phone calls in here. Hello?
Valentine.
Yeah. OK, I've got to go. I'm going into the doctor's now. OK. Speak to you tomorrow. OK, bye-bye. Sorry, that was the...
That's all right. Hello.
Hello. Long time.
Yeah. How's it going?
A bit up and down.
All right, come on. OK.
Some positives, some negatives. Some...
OK. All right. So, what can I do for you today?
Why ask you if you can help? My last Laurel's appointment, I talked about the gender recognition certificate. I need a supportive letter, one from my GP. I think it's just basically needing to know that I've been presenting myself consistently as female.
As I've said to you before, I am going to be quite happy that this is something that you've presented to me consistently, so you don't need to worry about me signing it when the time comes. All right?
Yeah.
So,
for a panel,
application for gender recognition certificate, OK?
So that's that. There's another thing.
Okay.
I talked to him about operations.
A breast construction.
Yeah, OK. She gave me two things that she required from me. One was to lose weight, and I've actually lost quite a bit of weight. I've reached the goal where she requested what I need, because no surgeon will touch me or go ahead with anything unless they can verify that I'm physically fit for it. You know, physically, not mentally, but physically fit.
OK.
And
There'll
I'm
be no
happy to-
reason why you can't physically have an operation. Mentally, that's more a different thing, you know, whether it's the right time psychologically for you. That's more for the Laurels to consider.
My question of mental health, I'm not questioning about my gender and the dysphoria, and you know that part of it. Like I'm quite stable in.
Well, I think as long as the Laurels agree with that, then that's probably going to be fine.
The question is over the mental state
Why
of all the other
Why don't you
things.
talk to them?
So if I discuss the mental side of it with them, and then go back to have the appointment.
Yeah, and then if
you
I
know.
get a letter, there won't be a problem.
So to say physically, I am physically.
OK. All right, Valentine. I'm with you all the way on that.
OK then.
OK.
I'll get. Yeah, great.
OK, doke.
Thank you
all
so
right,
much.
Well,
thank you.
That's all right. OK.
Yeah. OK. Thank
all
you.
right then. See you.
Okay, thank you.
Bye bye.
What can I do for you, Julie? You need a new name badge. Why? Yes, get Glenn to order you on. It's got to be yellow.
They got to be white. But then I had mine recently because they'd ordered it and they spelt Jackie wrong. Don't do the IE.
Hayley Beatty, please.
Hello there.
I wasn't hiding. Come on in. Thanks for waiting. I was having a little look at your notes.
That's okay.
Have a seat. Right, what can I do for you?
I've been having episodes, like last night, for instance, like I'm final day, my normal happy self, and then something just switches and I just cry, I can't seem to lift myself up, and I can't find a reason for why I've just changed either. Like, nothing happened in the day yesterday. I'm having ongoing problems with my neighbours, which has been going on for a while, and I'm trying to move. I sort of put my Cody to bed, and then it just went down.
I've had ingrown toenails for quite some time.
Right.
And I have been cutting them out myself.
What do you mean cutting them out?
Trying to cut them as good as I can.
Because I'm on my feet a day at work, sometimes it is really uncomfortable. I just want to put my feet in cold water.
So as I press down here, is it okay there?
Have you ever had one of these before?
Yeah, then back from Pakistan, I have a both nails.
Oh, yes.
I took them off.
You don't want that to go up there. That's horrible, isn't it?
Usually they're like really like pussy. They make
I think it's because earlier I ran on the field and I felt something hurt on my foot and it popped.
What have you done?
OK, so I noticed that my big toenail was getting a bit thicker, so starting to grow extra layers.
OK.
And I noticed that on the other big toenail, on the other foot, and they've continued to grow layers.
When you see them, you understand.
OK, so...
So it's got really thick, hasn't it?
Yes, but it's very loose.
Let's have a look at your other one then. The nail is obviously very thickened. Oh gosh, yeah, you have got layers, haven't you? Yeah. That's strange.
Yeah, no, curiously, my wife has very thick toenails. We think it's possibly a hereditary thing.
How loose are they?
The first top layer sounds very hollow.
So, I mean, I think that these layers is pretty much dead nail. I think what's happening is that you've got a chronic sort of detachment of your toenail for whatever reason, and then I think it's basically just not coming off fully, so then it's just attaching to the one underneath each time. The only thing you're going to be able to do is go and see a podiatrist.
Right.
Really, and then they'll be able to treat them and sort it. I think the main thing is going to be to file them down.
I think it's an angle grinder time, isn't it?
There's no infection or anything like that, so it's not anything that's causing a risk to your toe or anything like that. Can I take a photo? Then I know for future reference if I ever get any 16-year-olds with the same toenail problem in everything. It's quite interesting. Layers, isn't it? Like an onion.
Yes, it is like an onion. I didn't think they'd be having a photo shoot today.
There we go. A podiatrist will be able to sort them out, and then once they've sorted them, it's going to be a case of just keeping them filed down so that they don't get really thick.
Oh,
thanks for your time.
You're not the only one with weird toes. My friend has toes that look like thumbs.
Oh, wow.
They're really weird. Who's teaser? See you later.
When I get really anxious and I start cleaning.
Right.
So I was up to about 3 this morning cleaning because I can't settle, and I had no explanation as to why. It just switched like that.
So how long has it been like that for?
About 4 or 5 weeks now.
And you've suffered with anxiety in the past, haven't you? Are you on tablets for it?
I'm on sertraline, yeah.
100 milligrams. And how long have you been on that dose for?
Quite a while now.
And what's happening with you at home at the moment?
I'm having ongoing problems with my neighbours. General intimidation. You know, I have to walk through them every day because they sit outside. I've been on to the council, the housing officer, so I'm hoping to be moved soon. So I'm just trying to keep myself to myself. I'm walking through them now because at the beginning I was shutting myself in and I didn't want to come in, but now I kind of hold my head out and I just walk out. I had complaints. I've got cameras. They put cameras up, and I've got one that faces up the drive, which is fine, but now I've got one that goes towards my front door. So it's like I have to live like I'm in Big Brother.
Right. And is it just you and your...
Just me and my son, yeah.
And how old's your son?
He's 3, yeah, coming up 4.
Any nasty thoughts about harming yourself at all?
No. Back in the past, in 2009, I did go through a stage of that, but I think my son keeps my head above that level.
How would you feel about trying some counselling or talking therapies?
Yeah, I did get in contact with one, but they were supposed to phone me back and they never did. I'm not very good on the phone, so I'm not very good at...
OK. Maybe it's something to look at again.
Yeah.
Because I think you're going through a lot, you know, with your neighbours and, you know, single mum as well.
Yeah.
You know, it's hard. So you can email them. OK, you don't have to ring them.
Yeah,
so that's the first step.
yeah.
You could do that.
Yeah.
Then they do like to chat on the phone, the next step. OK, but you can give a specified time and, you know, when you're at home safe and you can listen and that sort of thing.
OK, yeah.
And so you try and contact the Bristol Wellbeing Therapies. Either come back and see me, Dr Ramshaw, or your own doctor in, I'd say, 2 to 3 weeks.
OK, yeah.
Is that OK?
Lovely, that's brilliant. Thank you.
Nice to see you.
And you.
OK.
Thank you.
Bye-bye.
Bye.
Can I help?
See a question. Do you do nail cutting here? Toenail cutting?
We don't.
Age UK, look on...
Oh, Age UK. Bear with me 1 second.
Oh, that's all right.
Find the number for you.
That's one thing I can't do. I get the clippers hanging like this. Oh, God.
Aha, so it says 15 pounds.
No, I think I'll struggle on, don't you?
Okay.
Right, I don't know what it is. I seem to be waking up on a morning as if I'm drugged. And I do tend to get giddy. I seem to lose my balance rather a lot. Luckily, I can hang on to things as well. But if I get up too quick, obviously. I've got, I think, I don't know, high blood pressure. I think it's low blood pressure.
And how long have you been feeling a bit dizzy?
A couple of months, to be quite honest with you.
OK.
I'm 76 now. So it frightens me a bit. And I didn't know whether I was taking too many tablets. So I feel as though I'm taking too many tablets because I'm taking either 14 or 15 on a morning.
So if you get up to move, is that when you feel a bit dizzy, or is it when sitting still?
I go to get up and everything's disorientated.
OK.
I know where I am.
Yes.
But it's just getting from point A to point B.
Things. OK.
Yeah, and it tends to frighten me. I think I'm going to faint over in a minute, you know.
Once you've sat down, if you're sitting down, do you feel all right?
Fine.
OK, so it tends to be when you've got up to try and move around that you can't, that you're a bit unbalanced. Do you want to slip your jacket off for me so I can just have a listen? Lovely.
OK.
Yep, that's perfect. OK, let's just have a listen. You can breathe normally. I'm just listening into your heart for now. That all sounds fine. Let's check your blood pressure.
OK. As you can see what the tablets are doing.
Yeah. To be careful with you, don't we? You've got delicate skin.
Yeah.
138/71. That's OK, but maybe it's a little bit low for you at the moment. Yeah, so you've had high blood pressure, a regular heartbeat, and a stroke in the past, and you've got the lungs. OK.
Yeah.
You're on perindopril, and that lowers blood pressure.
I did 2 milligrams.
You're on 8.
She put me up to 8 because she said the arteries are too narrow.
Yeah.
And she wanted to open the arteries to allow the blood to go through a bit quicker.
Yes.
So she said, I'm going to up it to 8.
That was about a month ago.
Yeah.
I just wonder whether that's what's made you feel a bit unsteady. Whether just that increase in dose, because that would fit with you feeling like this for about a month. Yes. I'm going to get you back down on the 4, just to try to see whether that makes a difference to this dizziness.
Yeah. How long is it going to be before I start noticing, if there is going to be anything, a difference?
A week? Yeah.
That's brilliant. Thank you very much. Thank you.
Is that OK?
Yep.
Great.
Have a good day.
Thank you. Bye-bye.
Thank you, love, for seeing me. Thank you.
OK, come and have a seat. What can I do for you?
Well, I've got like these random spots that come in about before because they were like they thought they were acne, but they seem to be like spreading like up here. They're in my eyes and stuff. I think they're in my ears, and they're really like itchy.
All right, and how long have you had them for now?
Maybe about 3 weeks. They just started on my arms, but I don't know if they're the same thing. But they're like, I've got tiny little ones in places that you can just feel like digging in, like.
Okay.
most of my mouth and stuff, so I don't know.
So it's itchy spots, you've had them 3 weeks, and they're getting worse.
Yeah,
and we've
then,
not
like...
tried any particular treatment for them so
No,
far.
it was just cream. Like, they said to get some... They thought it was acne, to get acne cream, so I just got, like, went to the pharmacist. Like I've been
Should we look at
scratching
your
here.
arm, first of all?
Yeah,
I'd probably look under a bit of magnification.
No, that's fine. And then some of them are, like, really, really tiny ones.
OK, let's look at this eye. Okay, what's your general health like?
OK, I think.
Okay. Some of these you've scratched, I think. Is that
Yeah.
right? Would that be right? Is that one not scratched and that one
Yeah.
not scratched? Okay. All right. Where else have you got some good ones to look at?
Do you want to see my back?
Yes, that's sometimes helpful, actually.
And my armpits are really itchy at the moment, so I don't know if they're in there.
OK.
Sorry, it's quite personal.
OK, let me just have a look at this. Again, I'm just going to look under magnification.
Yeah, no, that's fine. I think the more I touch them, the more itchy they are.
I think that's often the case. So when I look under magnification, what we see is a little red spot, often scratched, often with a bit of inflammation around the spot. And they look like septic spots. In fact, a lot of them look like something called folliculitis, which is where the hair follicles get inflamed and the bacteria have got sort of scratched into the hair follicles.
Around my hair on my legs.
So this is a little bit tentative of what I'm going to say, but quite a lot of these spots would do for what's called folliculitis, little bacterial infections. So they're hair follicles which have got infected with staphylococcal skin bacteria. Okay, don't look frightened. We've all got those. We've all got them. It's just some people they cause trouble and some we don't. Okay. I suspect you've scratched your legs. Maybe you've been a bit hot and sweaty, you scratched somewhere else and you've just spread the germs around and this thing has...
Is it contagious?
Not desperately so. I won't say zero contagious, but not desperately so. Okay. So these are the things I'm going to recommend, OK? Firstly, I'd like to recommend that you cut your fingernails as short as you can, at least once a week, and file them down most days so that should you be scratching, you can't be breaking the surface of the skin. Try and train yourself not to scratch these spots.
Just leave them.
Don't leave them, or if you can't bear it, just slap them, because slapping will relieve an itch a bit. Thirdly, I suggest we give you a course of antibiotics, and we'll do at least a 2-week course. I'll give you a small tube of a cream with an antibiotic in it that you can use on particularly itchy spots if they're really driving you crazy. All right? Then I think it would be prudent to get blood tests done, and particularly interesting to check for diabetes or getting towards diabetes.
No, that's fine.
But, because that can predispose to this sort of thing. I hope that things will turn the corner with that. If they don't, we'll see you back. All right?
I know it's right. Thank you ever so much.
Cheerio then. Bye-bye.
Thank you.
The printer's not working. Do you know what it is? Oh, is that all you had to do? Oh, what's going on here? Private prescription. I don't know why it's coming out 100 times.
Right, I'll put that up now and it should work.
That is lovely, thank you.
If it was a nice, easy one, I could do that.
Come and have a seat.
Breathing problems again.
Okay.
I think I've got another chest infection coming.
Okay.
I've fed up with it now. There's nothing, never gets to the bottom of anything.
Okay.
I've had x-rays, there's a shadow, it's decreasing, it's increasing, it's decreasing. Chest has been getting tighter and tighter, and now it's just like someone's permanently got me in a sort of bear hug sort of thing, finding it really hard to breathe.
Fine, okay. Any fever?
No.
Or are you bringing up any phlegm?
Green mucus.
Okay.
Whenever I cough, I bring up phlegm.
Are you a smoker?
Yes.
Yeah, okay.
I've had the cough for a year.
Okay.
Over a year.
Have you been feeling hot? Yeah.
Yeah, sweaty. It's just like someone's just permanently squeezing on my chest.
Yeah.
It's all across here. I've always been worried about lung cancer because I smoke that.
Yes.
And the pain's getting worse and worse as the years go on. For over a year now, I've been backwards and forwards to doctors, to hospitals for x-rays. There's got to be something wrong. It can't just be nothing.
And where do you work? What do you do? I work at a bar. Long hours and things? Yeah, that's what I've been doing, so I've just been getting really run down.
No, I work in kitchens.
What do you do in kitchens?
I'm a chef. So,
and where do you work?
I work in 3 places.
It's nice and relaxing. And what do you do?
Transport planning.
Right, transport planning. I think Bristol could do with a bit of transport planning.
You used to work in an oil rig, is that right?
Oil tankers.
Oil tankers.
Must have been good 20 years ago, yeah.
How are you today? You all right?
Yeah, all right. I've been on my knees all day, replacing floors. It's a dirty job, but someone's got to do it.
Indeed.
I used to be in
the lifting game years ago. Removals,
There you go then.
domestic and industrial.
Got the perfect job for you then.
Yeah.
Come on in.
Where would you like me to place it?
Let's go down this end, shall we? Then
Okay.
you can sit on that chair.
Yep, I'll do that. Is that right the way round or
It's the other way round, but
Oh,
never mind.
I should know that anyway, shouldn't I?
You should do after all
Yeah,
this
I should
time,
do,
shouldn't
yeah.
you?
I'm a little bit scrambled at the moment.
How's the leg?
Well, I haven't had any distress with it, I've got to admit.
Right.
But maybe I didn't have them up. But that's looking better, though, isn't it? I think. It's looking a lot better than it was.
Yeah.
I think being on the move all through the day has helped it out. It's
Yeah, it's getting there, isn't it?
it's a silver lining, like, you know.
Right, yeah.
Yeah, lovely.
Let's have a look at this then. So that's good, isn't it? Good. There we go then.
But I would think, what would you reckon, another week or two on this one?
Yeah, another week or two.
Well, all I can say to you is have a nice end to the week, have a nice weekend.
And you, yeah?
Yeah, thank you very much.
Okay, take care, bye-bye.
Take care, thank you, bye-bye.
It's not located down this side like it usually is. It's all across the top half of my chest here.
The pain that you're getting now?
Yeah.
OK, yeah, OK. Are you working?
I'm a plasterer.
You're a plasterer, OK. Have we wondered about whether your work has anything to do with your chest?
I've changed jobs. I was doing things like plasterers. I wear a mask, I wear goggles.
Yeah.
Except for the other day when I went to the hospital to get plaster washed out in my eye, but yeah. So I changed from building sites to private little home jobs now, working for myself. It's not so dusty, so.
And you've had a chest X-ray?
I've had 3 or 4.
Yeah.
I have to have regular ones.
OK. The X-ray I'm looking at, they've said that there are prominent markings in the left lung base again.
Yeah.
Respiratory physician opinion could be helpful. So have you been to the hospital to be seen?
I've had no appointments for nothing.
OK, all right. And have we done any breathing tests with you here?
I can blow perfectly all right on these tubes. Apparently I've got brilliant.
And have we ever got you to go into the treatment room to do some breathing
No.
tests? OK, fine. That might be just useful to do as well. And you've had blood tests?
I've had blood tests, I've had this, that and the other done.
Let me just do the usual sort of
Usual
check
stuff,
your
it all
oxygen
comes
level.
back properly and clear.
Oxygen levels are good, 99%, so that's good.
Always comes back the same.
87. Yeah. Do you want to, if you were to lift up for me, that's great. And just take some deep breaths. Just lean forward for me. And take some deep breaths again. Okay. I can't hear anything down here different. I'll give you some antibiotics today. If that you're bringing up mucky phlegm and you're feeling unwell. Any weight loss?
Weight gain?
Wait, have you been gaining weight? OK, OK. It sounds like we ought to be doing some more blood tests and some breathing tests and making a referral to the hospital for them to take a look at you.
Probably my lungs full of smoke.
Smoking?
Yeah.
Are you ever going to stop?
I tried one of those vape pens and my chest got worse, not better.
OK. I mean, ultimately, your chest would improve. You know, it's better for your health overall to stop smoking.
Yeah.
Sometimes there is a really difficult bit when people first stop smoking. So there are...
I feel sick.
And that's probably the lack of nicotine, because it's the nicotine that's addictive.
Oh yeah, I want to stop smoking. Obviously I don't want to be a smoker. I don't want to kill myself, do I? I've got young kids. So.
Yeah. We've got people trained up here to support people to stop smoking. We know it's hard to do.
I'm willing to give anything a go that makes me feel better.
And
what about the hospital?
I'll make a note to myself now to make a referral for you.
Thank you very much.
All right.
Thank you.
OK. Bye-bye then.
Bye-bye.
So if you say newly nailed, it's there now.
Oh, brilliant. OK, thanks, good.
All right.
Thanks for that. Cheers. Tanya's back on now, the phones, so you're all right.
Sorry, are you talking to me, Nigel? Just
I was trying to.
chewing a brick.
Hello there. I'm Dr. Bolam.
Yeah, hi.
And this is Harmen.
Harmeen.
Harmeen.
Yes.
Sorry. OK. OK. And she's just 4 weeks old.
Yeah.
And she's your third baby, is that right?
Yeah, she is. I've noticed this morning her nose was bleeding.
OK.
You can see this.
Oh, yeah.
This is bleeding this
Yeah.
morning. But whenever she sneezes,
Oh, I see.
you can
I
see it here.
OK. Are you breastfeeding her?
Yes.
OK. And is that going all right now?
Yeah.
I'll have a proper look at her in a minute. But how does she seem to you now? She seems well, does she?
She seems okay, but I just worried about the bleeding.
Yes. Okay.
Yeah. Yeah.
There's no rash on her.
Yeah. Her body was full of spots about 2 weeks ago.
And that's In fact, getting better then.
Yeah,
is it?
yes,
Well,
I'm
I'll tell
on
you
the
what, if you pop her on the bed and stay up there with her, and then we'll do a temperature and have a look in her nose and such like. OK? All right? Hello? All right? You doing some puzzles there? Very good. All right. OK. Right then, let's have a look at you then, madam. Hello? Hello, what's going on? What's going on? It's OK, so she's no temperature now, all right? It's 36.9. OK, right then. Is the blood only coming out of that right nostril?
I
It
think
looks
so.
like it is,
Yeah,
doesn't it?
yeah,
Okay.
yeah.
Yeah, OK. Hello. There's just a little sore area on the edge of her nostril, all right?
OK.
OK. I'm not worried about that. OK. All right, she's well, she's no temperature, there's no worrying rash. She's feeding OK, she looks great, all right?
Anything I can give it to her?
I would just keep it clean, OK? Maybe boil some water, let it cool, put a little bit of salt on it and just, you know, bathe it a couple of times a day with some cotton wool. Is that all right?
Yeah, yeah, that's fine.
She's fine. Congratulations.
Thank you.
So you've got a boy?
And 2 girls.
And 2 girls.
Yeah.
OK. And you the biggest? How old are you? You're about to be 10. OK.
10 days.
Oh, 10 in 10 days. OK. Cool. How old's your other sister? 8. OK, so Mum's had a bit of a gap there.
Yeah.
OK, so you're remembering how to do it.
I totally forgot everything.
Yeah. It's coming back though, is it?
Yeah.
OK. All right, so keep an eye on that. Obviously, if anything seems to get worse or she goes off her feeds or you're in any way concerned, you bring her back.
Thank you so much.
All right, no, that's my pleasure. Have a good birthday.
Thank you. Bye.
All right, bye-bye now. Bye-bye.
Thanks very much.
Good news.
I shall see you later.
Absolutely.
Thank you so much.
Good, nice to see you.
Thanks a lot.
Cheers,
Bye-bye.
bye. All right, not a problem. OK, all right. Thank you. Oh.
Take care.
All right,
See you later.
cheers.
OK. Come on then. Are you going to stay with me? Come see all my patients. Bye-bye. Bye-bye.
Centre, can I help?
I had that Baker's cyst around behind my knee. The amount of pressure now from, like, literally my knee downward, it's just so painful. I can't straighten my leg now.
So you OK having your bloods done?
I think so.
Do you tend to faint?
I won't look, put it that way.
You won't know, no, but do you tend to faint?
His tears are bloody and there's a bit of blood in the corner of his eye.
OK.
Just pull down your trousers, lie curled up in a little ball on your left side with your knees up to your chest, facing the wall. Are you ready?
Oh, I wouldn't say no to a cup of tea. That would be amazing. Georgina, I have a fund. People put in £5. People just help themselves to squash, sugar, biscuits, chocolate biscuits. There's hot chocolate in there. There's biscuits, mints upstairs. So if you want to join the fund, let me know. Oh, and Heather does obviously the milk fund as well. I don't know how much she charges, though. I'm not in the milk fund.
Janet Shaw, please.
Yes.
Hi there.
Hello. I think I've seen you with Janet before. I'm her sister and carer.
I didn't see her there.
Of course, her little legs don't keep up with me.
Well done, come on in.
Come on in, Janet.
Hello, yes.
Hi there.
Well, unfortunately, Doctor, Janet has had skin cancer this side.
Right.
And had an operation.
Right.
But I'm not happy about what's happening here at the moment.
And what has been happening?
Well,
Tell me a little bit more.
I looked today and it was weeping.
Right.
And I don't quite know whether to cover it up or let it just go.
And has it grown at all, or has it just been weeping?
Very quickly.
Has it? So it's grown quite a lot?
A fortnight ago, we went to see the dermatologist on a Saturday.
Oh, right.
She got to have another operation.
I see. So the operation is coming. Did they say what kind of skin problem it was?
I think it's carcinoma.
Basal cell carcinoma is one of them?
That's it.
Is that the one? OK. Have you been in touch with the dermatologists?
No.
We need to get the message back to them, don't we? So that they can then see what they want to do. Can I have a little look?
Yes. But the other one, it was just warty, like a wart. But this one is like more ulcer.
Yeah. Because I think it does look like a BCC, and they can sometimes get an ulcer in the middle. It doesn't look like it's infected to me, so I'm not worried that there's something else going on, and I will write to them telling them that what size it's got to with the ulceration and the weeping, and otherwise I'll just cover it over. I will see what they can do.
OK,
and ask them to give you a ring. All right.
Bye.
No problem. Nice to see you. You go well.
Bye.
Jolly good. Bye then.
Bye.
Lene, please.
Come on, then.
Come in. You're all colour coordinated with your dress and your shoes. Thank you for waiting.
That's all right.
Right, which one are we seeing?
This one.
This one?
Yeah.
You? Do you want to play with the trains? Do you want to play with these? You want to have a play?
You watched
play that one.
with me, yeah?
Right, what's been happening then?
Well, she's been complaining that she doesn't feel very well. But then last night she wet the bed, which is very unusual for her, and she's been going to the toilet like every half an hour to 45 minutes, and she's done 4 poos as well today.
Oh, right, OK.
So, yeah, it's quite unusual for her.
Any diarrhoea at all?
No, no diarrhoea. And she's, I don't know if she understands, but I've asked if it burns or anything when she wheezes, and she says no.
Right, OK.
But it's just more, she keeps saying that she doesn't feel very well.
Right, OK.
I bought you a sample just in case.
Brilliant. Do you think she's had a fever at all?
No, she's been normal, like normal behaviour.
Let's dip this then. She had a urine infection ever before?
No.
Hello? No. I'm going to dip this in here. See what it says. Let's just give that another minute.
OK.
Can we pop you on the bed so I can feel your tummy? Oi, go, you're heavy. Right. Are you ticklish? Yeah. There? There? Right, let's have a feel of your tummy. Does this hurt anywhere? No? That's OK, that doesn't hurt. Fabulous. OK. Right, do you want to get down again?
Ready? Jump.
Oi.
Good girl. Sorry. Come on, then.
Let's see what this is saying. Oh, yes. It has developed. Yes, she's got a urine infection.
OK.
OK. Now, what we'll do is, with children, we send their urine off anyway, just in case it doesn't respond to the first lot of antibiotics we give them, then we know what to give them next. So I'll send that off. But if she's getting worse at all, you think she's developing a fever, she starts saying she's got tummy ache or anything like that, ring 111 straight away so that they can see her out of hours.
OK.
And then just loads of water.
Yeah. That's fine.
All right?
Thank you.
And I'll bring this out to you. If you have a seat in the waiting room, and I just need to sort this prescription out, and I need to get the duty doctor to sign it.
All right. Thank you very much. Say thank you.
Bye-bye.
See ya.
Right, how can I help? So from Saturday night, I had like really intense chronic stomach pain and then intense pain again Sunday all the way through the night. So it's basically every evening or earlier, it's just like chronic pain. Sometimes it's like a burning sensation here.
And during the day, it seems okay or it's gone
just really
or
sore.
easier?
Yeah, it's just really tender at the moment.
So it's mainly the pain that's bothering you and you're off your food, you don't feel like eating. Any vomiting?
Yeah, twice last night.
You don't smoke, generally fit and well?
Yeah.
When was the last time that you took any paracetamol?
I tried to take some last night, but I was sick afterwards, so that didn't really happen. And then I got given cocodamol last night, and I was going to take one before sleeping, but then I was actually like quite sick, so didn't take any.
Open wide for me. Big amounts of vomit?
It was just like the little amount of food I ate.
Have you had anything to eat today?
Half a slice of toast.
And that's it. And you haven't really been eating well since Saturday?
Yeah, so about a slice of toast a day, maybe some natural yoghurt.
If you come and have a lie down here, so you haven't travelled anywhere in the last month. Did you go somewhere before that? It sounded like you may have done.
I was travelling Asia for 7 months.
But were you well after that?
Yeah, really well.
So did you get any tummy bugs or anything while you were out there? Because it's sort of standard.
Yeah, so I got a few there and, like, obviously know how bad that gets, so I wouldn't be going to A&E unless it was chronic.
The pain's worse at night, but it is there pretty much all day?
It's tender now, so, like, if I was in the pain I am at night, I would definitely be like, oh, that's a bit tender there.
OK, that's quite sore for you, isn't that? I'm sorry.
It's fine. I'm just worried of what it is.
Hello, it's Colton at reception.
Hello. Just wash it. That's fine.
Hi, it's Dr. Ramshaw from Horfield Health Centre.
Hello.
No problem.
The dog really needs a haircut.
They don't do buy one, get one free.
I'll sort that out for you.
Tell me what tablets they were.
Hopefully that should clear it up.
Bye-bye.
See you then.
Bye.
Cheers, bye. OK, all right, in you come. All righty. I haven't seen you for ages.
I know, isn't that good?
Well.
This is about my knee.
OK.
You know, I don't know if you knew, I had that Baker's cyst in the back and
yeah.
The thing that they wanted to go forward with was injections into the kneecap and I just really didn't want that because, well, I know a few people who'd had it done, it didn't necessarily work and from what I'd read up about the cyst, it might strengthen my knee, but it wouldn't necessarily do anything for that.
OK.
Now, this is filled into such... Because I've been sat with my leg bent. I pull my wheelchair forward like this because I'm so weak down one side. I can't use both hands, really, to wheelchair.
Dragging it with your leg.
And I've been doing it for years. It's just filled up so much I can't straighten my leg now.
Right.
Down behind my knee.
What would you like me to do today, then? I will have another look at it.
I'd like to know if we can drain it, because the amount of pressure now from, like, literally my knee downwards and what it's doing on this foot, it's just so painful.
Maybe we'll do this with you on the bed, Alison, actually. Is that all right? Might be easier.
It's just so painful to actually straighten my leg. It's,
Yeah, OK. So if you can hop over and lie on the bed probably on your front, actually.
OK.
Have a look at that.
Yeah.
A Baker's cyst is a fluid-filled swelling that develops at the back of the knee. Sometimes it's caused by trauma or by osteoarthritis or some other form of joint problem.
I went to Liverpool last week.
OK.
And it was...
You've had a top-up on your accent.
It's... I have, actually. That's funny you say that. But I got, like, one day in and it, literally I couldn't even pull myself round just anymore.
OK. Swing yourself around. So, I still think it's a Baker's cyst, OK. What do we do about it? I'm not just going to stick a needle in the back of the knee myself because there are other structures in the back of the knee and, you know, you could do harm. OK, I'll ask for an ultrasound scan of the back of the knee just to confirm it's a Baker cyst and there's nothing else going on, all right? Simultaneously, I'll also refer you to the musculoskeletal assessment service for them to advise on what's the best way forward, which I suspect will involve the help of an orthopaedic surgeon. Actually.
OK.
Yeah.
Thank you.
Is that all right? Is that a plan then?
That sounds
OK,
brilliant.
so I'm just going to write in my book to get those two things done.
I was worried you were going to say, well, actually, steroid injections under the kneecap is the only way forward.
No, I think it's a bit too big for that, actually, to be honest. Yeah. When you go for your ultrasound, you'll get an appointment through the post for that. OK, I'll do those referrals.
Thank you.
Yeah, lovely to see you.
Thank you.
OK, go for yourself.
Bless. Have a good day.
Cheers.
Let's just have a check of that. So there's no sugar in your urine. There's lots of ketones. I'll explain what that means in a second. No signs of infection on this sample. So ketones in the urine means that you're getting a bit dry, a bit dehydrated, and you look a bit dry, a bit pale. So I think we've come to a stage where you would benefit from having some fluids through a drip and some blood tests just to see what's going on, maybe an ultrasound scan. It's not fitting into an appendix kind of picture, but it could be pyelonephritis, which is that you get a kidney infection, but the urine's not always showing anything up. But I think we've got to a point that we need a bit more help with it. You haven't got a temperature or anything like that. Your blood pressure is a bit low. And that's also why I'm a bit worried about you being a bit dry.
Yeah.
Is there anyone who can take you up to the hospital?
Yeah, my stepmom's coming at
All
half
right.
an hour.
You look very upset.
I am just worried.
What are you worried about?
Just that I don't know what's going on.
Yeah, OK. But you're dry, and we need to just pep you up, do some blood tests and see what's going on.
Yeah.
You don't have to wait in the main area. I can give you the side room to wait and make a call.
Yeah.
And I'm going to speak to them at the hospital about this.
Thanks. Cheers.
All right?
Yeah, that's great.
You know there's a water fountain, so it'd be good to drink some water.
Yeah, gonna drink some more.
So if I show you where that is, because I'm just going to make a call. Don't forget your things. All right?
Thank you so much. You've been really helpful.
Just got a lady in here, OK?
Oh, yeah, cool.
Just in there.
Thank you.
That's OK.
Not very good with needles.
Not many people are.
If you want to have a look, that's fine, but just in case it makes you feel a bit funny.
Do you not like looking?
No.
I've got good veins.
Yeah.
My best friend's a midwife and she loves my veins.
I find it satisfying watching this.
Flowing well today.
I'm sweating.
Oh, you just keep on taking the blood.
Got me sweating as well.
Sham stock. All right, if you just want to come take a seat.
Hi.
How are you feeling? You all right?
I think so. I think so.
Good. Just going to do a quick blood test. Are you OK having your bloods done? Do you tend to faint?
I won't look, put it that way.
You won't, no, but do you tend to faint? Do you think you'd be all right, or would you prefer to lie down?
No, I'll be all right.
Yeah?
I just won't look.
All right. Not many people do.
Is that so? All right, so I'm not abnormal then?
No, I don't look when I have a blood test taken.
Oh,
and I do it for a living.
Okay. So this blood test is going to test all sorts of things, is it?
This is going to test your HbA1c, which is your sugars, full blood count, which will check your red blood cells and white blood cells, haemoglobin, electrolytes, which is your kidneys, your liver function test, which is your liver, lipids, which is cholesterol, and your thyroid.
Right, OK.
So giving you a bit of a...
They're all over the same?
Check-up, yeah.
Right.
Are you OK with plasters?
Yeah. No problem with that.
All right. Okay, I'm just going to wash my hands.
So this is all part of this sort of health check, then?
Yeah.
Yeah.
So this is the reason why we're doing it, is just because it was advised that you needed the blood to do them. All right.
Right.
Your BP was done
yesterday.
Last time. Yeah. Oh, it was yesterday, was it? And that was OK.
Yeah.
So that's good. So now we just need to wait for the results of the bloods.
So yeah.
All right.
So...
Which time do we go for when taking bloods?
Oh, let's go for that one, because I can look this way, can't I?
All right. All right. Right, do you want me to tell you what I'm about to do? No, just go ahead and do it.
Just go ahead and do it, yeah.
All right. Oh, bless you.
Yeah, I used to give blood very occasionally.
Yeah.
And the last time I gave it, I keeled over completely. And they said, oh, please don't come back again. And I said,
really?
well, don't write to me then, keep asking me.
Yeah.
So they haven't since. How much you taking?
Just two small bottles, all right?
2 small bottles? Gee!
Well, no, not bottles, but like 2 blood vials.
Right, OK. I imagine it's a massive thing now. Is it all done?
No. All right.
All done?
All done.
Oh, fantastic. That was amazing.
Oh, thanks.
Yeah, no, brilliant. I've been gearing myself up for this.
Oh, bless you.
It's ridiculous, isn't it? It really is.
No, it's not. If you bear with me a second, I can pop a plaster on.
Right.
All right. Don't want you walking out of here and leaving a little trail of blood behind. Scare off the rest of my patients, you will.
So the results, will they tell me?
The results will be back in 3 days.
Right, OK.
And we can give you the results over the phone.
Right, OK. No, that's brilliant, yeah.
Let's pop a plaster on for you.
Gee, that was a lot. I got to eat and drink loads tonight, haven't I, to make up for that.
Such a big amount. All right.
Probably stopped, is it?
Yeah, perfect.
Right.
Souvenir to remember me by.
Excellent.
All right.
Thank you so much. Nope, that's brilliant.
No worries.
Have a good afternoon.
And you, take care. Bye.
Thanks. Come along in and have a seat. You okay there?
Yeah.
Right. How can I help?
My tongue is hurt.
Okay, your tongue is hurting.
Yeah.
Okay.
My throat.
Okay.
Burning.
Okay, your mouth and throat are burning. Okay, yep.
And it like sandpaper.
Okay, fine. How many days? How long has that been feeling bad?
For a while.
For a while. Okay, okay. And are you feeling well in yourself otherwise?
Low emotionally.
Just say that again.
I will write it.
Okay, okay. I didn't quite catch that bit, so that would be helpful. Okay, so you're a bit low in yourself. Yes. Okay. Shall I have a look at your throat in the first instance? Actually, I'm going to start off by just checking your temperature. So, can I put this in your ear to check your temperature? Okay, that's great. That's fine. That's not that. No fever. Okay. And now let's have a look in your throat. That's great. And just say ah. And again. Fantastic. Okay. I can't see anything, any muck in the throat. Let me have a little feel. Can I just feel your neck?
Yeah.
That feels sore there. Okay. Are you able to eat? Okay. I think, as I say, the throat looks okay. I can't see anything particular in your mouth, but I think if it's feeling sore and it's feeling like sandpaper, something that might be causing you problems is thrush. That can make your mouth feel very uncomfortable. It's a very simple treatment. And then if that doesn't help, you can come back and see us. I'd give you a week's course and see if that would help. Okay. The other thing you said was feeling quite low emotionally. Do you think that's tied up with your mouth getting you down, or is that a different thing?
Different.
Different thing?
Yeah.
Okay.
Different thing that I'm a human being.
I think I'm going to need to get you to write that bit. I didn't quite understand. Oh.
That's how you feel, that some people are disregarding you as a human being?
I'm a human being with a disability.
Yes.
Well, the disability is not the hard thing.
OK.
Take a seat then, OK?
Are you ready then?
It's a digger, isn't it? I'm not digging that at all. No, I can't bother to do that. What about this one?
Look!
He's riding a kangaroo.
Hugo, please.
Come on.
Hiya.
Hello, how are you? Hey, how are you doing?
Morning. Yeah, good, thanks.
Good.
Hiya, so what's been happening to you then?
Hugo fell down some stairs this morning. He was coming down the stairs behind me, and I turned around to like pick some wet wipes off the stairs, and he just like came down in front of me, and so I caught him on the rebound. I don't think he was that far behind me, so I think he maybe fell down a few steps straight down onto his head. And cried a bit.
Sure.
And then stopped crying, and I thought, this is cool. But then I noticed there's a bit of, like, his tears are bloody, and there's a bit of blood in the corner of his eye.
Okay.
So they're like carpet-covered wooden stairs, and he cried for...
And he landed on the stairs rather than on a stone or anything harder?
On the stairs, yeah. On the stairs, yeah.
But he hasn't been sick or had obvious problems with his vision or...
No, he's been really perfect.
Using his arms and legs all normally?
Yeah, everything
Eating
fine.
and drinking
yeah,
fine?
It's normal.
Just got this bit of blood since
yeah.
then. Hello.
He might have stopped
Hello.
now, but he was
Can I
there for a
approach you?
while.
Can I tickle you? Right, let's have a little look. Look over here. Good boy. Look over here. So his eye itself seems absolutely fine, doesn't it? Just a bit of bruising just underneath.
Yeah.
There is just a little bit of bruising just under the eye, and I think you're right. I think he's just got a little bit of tiny burst blood vessel there. In fact, right in the corner of his eye, I can see.
Yeah, that's where the blood was coming from.
But the eye itself looks completely fine.
Yeah.
And he's moving it around completely normally, and he's following, and he's obviously interested in, you know, obeying my instructions and doing everything he should be. So that all looks fine. Let's just shine a light in it. Good boy. Can you smile for me? Give me a lovely smile. Can you give me a smile? You've already shown me that you can do a nice smile, so I'm not too worried that there's anything else going on there. I think my sense is that he's just got a minor head injury from this fall, and that this is nothing that we need to be worried about. I think he's going to get a little bit of a black eye, and you know, that's okay. What we don't want to see is him vomiting, him having obvious visual problems, getting drowsy. Those are all the sorts of things we get worried about with head injuries. Obviously, if he had a fit or started getting drowsy or you were worried, then bring him straight back and we'll do something more. Then we'd need to get the hospital involved.
Yeah.
But, you know, head injuries are really common in children, and as long as they're minor and we're not worried that he's done himself any major mischief, which is the case now, then actually we can just keep a really close eye on him, and he'll just get on with life as normal, I'm sure.
Yeah. Thank you.
Does that answer all your questions?
Yeah.
Super job. And obviously just some Calpol.
I really wasn't worried. I mean, if I thought anything was really bad, I would have gone to A&E, I suppose. But
super job. Nice to see you then.
Thank you.
Bye. You going to give me a wave? No.
Say bye-bye. Say thank you.
Bye.
Good boy. See ya.
Bye-bye.
OK, so you have a disability, but that's not the whole thing?
Yeah.
Yes, OK.
And...
So you feel everything is put down to disability?
Yes.
And that's not how it feels? Yeah, that's...
And I'm supposed to be having some counselling.
Some counselling, OK.
But nothing seems to be happening.
OK. This is going back a little bit, but there was a plan for you to have a scan of your head.
Yeah.
Has that happened?
Yes.
OK. And do we know the result of that?
I don't really understand it.
OK, let me just have a quick look.
Let me have a look at the last letter. Here we go, right. They found something very, very tiny that they want us to monitor. It's that the presence of this little something in the pituitary gland in the head, they say suggest that it's not a good idea to prescribe you medication that they had considered because it's there, and that you're to have annual, yearly blood tests to look at the prolactin, which was that hormone that was found to be a little bit high. The main role it has really is in breast milk production, but it is also important in terms of regulating the periods as well. But I think though yours was a little bit high, they've sort of found that there's just a little tiny area within the pituitary that's producing that little bit too much of it. Yeah. OK, I think what I'm going to do now, because I'm slightly running out of time today, is to leave a message with Dr. Clark to just ask her whether or not we need to do any looking into your counselling.
Yeah.
OK? OK, so that's a prescription for your mouth.
Yeah.
And let's see if we can get that feeling a bit better for you.
Right.
All right.
Yeah.
There we go. Yep. All right then.
Thank you.
OK, nice to meet you.
Nice to meet you.
OK, take care.
Bye.
Bye-bye.
Oh, it's you.
Yeah, you.
Good. Just finished?
Well, yeah, in a second.
Oh.
I got a card today. I'm really chuffed with it. Oh, it meant so much to me. I'm patient, but it's really, really nice. I cried.
Oh, what? So thank you. Oh.
Yeah, so I'm chuffed.
Look at you.
So when she gave it to me, I was like, there's just tears. It would just come in.
I was like, soppy thing.
Oh. So nice.
Have a seat.
Oh.
How can I help?
My bladder.
Your bladder, yes.
I'm now peeing since I don't sleep.
Yeah.
It's hard to say, but every hour.
Yeah.
Day and night.
Right.
And sometimes even more than that.
Why do you think you've got a problem with peeing?
I have no idea.
So often?
I pass a huge amount as well. It's not like
Right.
a tiny bit. It's like, you know, pint.
Really?
Yeah. And I just don't know where it's coming from.
Do you drink quite a bit?
I drink a lot of
Fluid-wise?
tea.
Yeah. How
when
much?
I'm working in the night. Maybe 2 cups of tea in an hour, say, perhaps.
So do you drink 2 cups of tea every hour overnight?
Yeah.
So that might be that you're drinking 10 to 12 cups in 24 hours of tea.
Yeah,
at
definitely.
least.
Definitely.
Yeah. What about coffee? How many coffees in 24 hours?
Maybe 3.
Any other fluids apart from tea and coffee, or is that your main
Water.
fluid intake? And do you, well, how many cups of water would you have in 24 hours as well?
4.
OK. So when you add all that up,
Yeah.
and if you were to do a sort of fluid balance thing,
Yeah.
and you were to look at how much fluid you're taking in and how much you're peeing out, it may not be that different, but the difference is that at the moment you're awake all night, which you aren't normally, or you aren't always, shall we say. The problem with tea and coffee is they've got caffeine in them, and that makes you pee more.
Does it? Right.
Definitely does, yes. OK? So that one of the things that you might find helpful, whilst we try and work out what the matter is to get some decaffeinated tea.
Yeah, I could probably drink... Leslie drinks decaffeinated tea.
Does she?
Yeah.
OK. Well, why don't you switch to that in the first instance, see if that makes any difference.
That'd probably be all right, because it tastes...
OK. How long do you think things have been worse for with your urinary frequency and urgency?
6 months.
Are you worried that there's something a bit more significant going on?
Not because you told me that, you know, you've examined my prostate
Yeah,
sort
is
of
that
relatively recently. Well,
Have
I came in and you told me you'd done it the year before, I think, last summer.
Here it is. It was June 2015. But I guess we could do it again because it's changed so much in the last 6 months. Do you see what I mean? Do you want me to do that now?
OK. No, it's fine.
Get it done?
Yeah.
Yeah, just to see whether your prostate has got bigger. So I think, but we ruled out diabetes. So I think I should examine you, you should have a blood test done, and then we should discuss the result and work out what we're going to do next. But I think if you reduce your decaf, you might be a lot better.
Lifestyle change.
Yeah, you're good at that, sometimes.
What does it mean?
Reducing the amount of caffeine. Just pull down your trousers, lie curled up in a little ball on your left side with your knees up to your chest, facing the wall, OK?
There's a big fuss made about this test.
There is.
Which I think is silly.
About which test?
This test.
Oh, having...
There's nothing horrible about it. It's
not
perfectly
too
fine.
bad, is it? No. You ready?
The next one, yeah.
It's the next one.
Yeah. Put in a camera or whatever.
Yeah, that's absolutely normal. You have not got a big prostate.
Good.
OK? Now, don't fall off as you get dressed, because it's a really unusually narrow bed, OK? OK, so unfortunately, we haven't got anyone who can do bloods today.
OK.
But I don't think it's urgent. I think just have the blood test done in the next couple of weeks, OK? That's for you to have a read. Is that all right?
Yes.
Today? Yep. Great.
Cheers.
Very good. Bye.
Hi, how are you doing? We're right down the end of the corridor.
Why?
A bit of a long walk. Nice bit of exercise. Come on in, take a seat.
Okay.
Right. You okay there?
Yeah, fine, thanks.
Right. So, I was just looking at your notes from last time, because you saw Kaylee, didn't you, last week?
Yes, I did, yeah.
And you weren't feeling too good, were you?
No, I don't know what it is. I think I've got conjunctivitis as well. Some stupid thing going around in my head.
Your eyes look okay. Do you want to take your glasses off? Let me just have a look.
Yeah, sure.
Are they very weepy? Are they sort of crusty?
Just a film across them.
Right. When you wake up in the morning, is no crustiness or?
No, that's not there.
They look absolutely
They look
fine
all
at
right.
the moment. Yeah.
It's got to be my glasses gone wrong. I need a new pair,
Yeah.
definitely.
Would you like me to give them a little bit of a clean?
Please, they've been through the wars with me.
Yeah.
So I don't want to get rid of them.
So are you
but
feeling a bit better now?
Oh, yeah, from that, yeah, I am. I blamed whatever I had on my eyes as well, mine, but I blame everything on that.
Try that.
Yeah, thank you. That's because these are designer. I paid a mint for them. Oh, that's see everyone now.
Is that better? Is the filminess gone?
Yeah, there. I'm a bit undaunted now.
Okay.
Oh,
so let's have a look at your leg. Is it?
Here are. I thought my new stockings had come through. Sorry I didn't bring them in today.
That's all right.
I did change it the other day.
Okay. Just pop your foot on the tissues for me.
It's on a leak.
Yeah. Because, usually we put a big pad on, don't we?
Yeah.
So you changed that, did you?
Yeah, it leaked the week before. It leaked everywhere. I thought it should be under the foot as well, that dressing that you just taken off, that long yellow line.
Yeah.
It's not very nice, is it?
It looks like it's half off this one anyway.
I think that's going to need a bit of dressing help.
So it's not oozing any liquid, is it?
Our nurses are the experts as to what's the best dressing, so we'll go with their advice.
All done. Lift your foot up, just so until you hit that. Have you still got your lodger with you, or?
I do, yeah.
Yeah.
I do.
Does that work out? Or...
He's gone away. He's gone. he's a kind of carer, so he's only sort of part-time with me.
Oh, yeah.
Yeah, he's gone away.
Oh. Does that feel okay?
Yeah, very, very nice. Thank you. That's it.
Yeah?
Yeah, that's fine. That's lovely.
You sure?
Yeah, that's lovely. Yes, thank
Don't
you.
be tripping up. Well, it's nice to see you, Linda, and...
Yeah, thank you very much, Sue.
No worries. You come up with me now.
OK, thank you.
We can...
OK, that's lovely. Thank you very much. Okay. Yeah, thanks very much.
Gonna be... Riley Warner? Oh, that's me. Sorry, I'm so late. I'm late anyway. Have a seat. I'm absolutely boiling. Right, what can I do for you? Well, firstly, I wanted to get another prescription of the pill. Right, OK.
But then I also have been looking at getting the coil. Because
Okay.
I'm not very good at taking it regularly.
It's a good reason to consider something else.
Yeah, because I did have the implant and I didn't really like that.
Yep, no, it's a really good option. So have you looked into the 2 kinds of coils?
No, I haven't.
Right, okay.
That would
Right, so there's 2 kinds, 2 main types, okay? One that has a hormone and one that doesn't, that we call the copper one. So the simple one is the copper one that works as a contraception, as a device in the uterus, okay? And it releases copper that stops you getting pregnant and stops implantation. So it's very effective.
Yeah.
The downside of the copper one is, or it could be, not with everyone, it can make the periods a bit heavier. So the hormone one, okay, we fit it the same way, but it releases a small dose of progesterone. Okay.
Yeah.
So we suggest giving up to 6 months to let it settle down. So when I say settle down, I mean you might get irregular bleeding.
Okay, so it might be a bit kind of
all over the place, but then it often does settle, and in many people you get either very light, occasional bleeding or nothing at all.
Okay, yeah.
So the other thing to chat about is how we insert it. So have you ever had a smear test done?
Yes.
Yep, so it's a little bit like that, okay?
In the same kind of procedure.
Yeah, exactly. So the doctor does it with the assistance of a nurse, okay? So it takes about 10, 15 minutes. So when we put the coil in or when we're using the other instruments, there is an increased risk of perforating the womb.
Okay.
So that's a risk of about 1 in 1,000.
Okay.
There's a risk of infection. There's a risk of it coming out. Okay, if you had a very heavy period or something like that.
Just check it.
Yeah.
Okay.
Yeah. So the other difference is the copper can be inserted for 10 years and the hormone one is for 5 years.
Wow, okay.
Yes.
That's quite
okay.
long.
So shall I give you some information
Yeah,
about
that
them?
would be great. That would be really great, please. Yeah, I don't think there's any other questions. I'll read this and
Yes,
probably
so have a
loads
read.
of questions
yeah, well,
afterwards.
that's fine. Just give us a ring and
Okay.
we do telephone consultations so I could chat to you.
Oh, okay. Yeah. That's brilliant, yeah.
Okay.
Thank you.
So in terms of your pill at the moment, so should we just give you some for now to be going on with?
Yeah, maybe give me another month or something.
Yeah,
Just,
okay.
Just so I've got... Just in case.
Yeah, no problem. You can have it fitted any time of the month, really, as long as you're definitely not pregnant.
Okay. Ah, that's good to know. Yes, thank you.
Yeah, no, it's a really good form of contraception. You can have it removed when you need to. Those leaflets are quite good, so have a little read.
Thank you very much.
Okay, no problem. Well, good luck on your decision.
Thank you very much.
Okay, no problem. Bye-bye.
Freddie, please.
Okay.
Hello. Don't recognise you. I think you've changed your hair or
Yeah.
held it back. Right. Hello, Freddie. Sorry, it's not. This is about you, isn't it? Let me grab another chair. Okay. There we go. You seem to have grown.
Yeah, getting bigger.
Oh.
So, do you want to tell Doctor first, or do you want me to?
You.
So Freddie's just started having a stammer.
Right.
It's not all the time, and he's always sort of had it there, but lately it just seems to be getting worse.
And so how long ago do you think this started as a thing?
Quite long ago. But it's just getting, like, worse and worse.
There was a time when it didn't happen at all?
Yeah, you didn't always have a stutter, did you? Like a stammer.
No. Are there times when it's more likely to happen?
It's mostly when I'm speaking to lots of people as well.
Does it happen at home?
Yeah.
Yeah. So mum, you hear it.
Yeah.
Yeah. Yes. Okay.
You know, it might be 3 or 4 times a day that he'll do it, but and then other days it'll be like constant, and he's really getting stuck, and he laughs at it.
Yes.
But I think at school he gets quite annoyed at himself sometimes, don't you? Although, you know, I think his friends are quite good about it. As well.
Yeah. Good friends.
Yeah.
Yeah. Good. Anything else that's upsetting you anywhere in your life?
No.
No. Okay. You're getting on all right in school. Do you work hard and do all right?
Sometimes.
Okay.
No, he's pretty good, I think.
Yeah.
You do get quite anxious sometimes, don't you?
Yeah.
If you are a bit anxious, it's more likely to happen.
Yeah.
So you're obviously, here with your mum,
feeling
But
quite
Freddie
calm.
does suffer sometimes, and he
Yeah.
did suffer with panic attacks.
Right.
Back in, was it about a year ago or so? And then I spoke to Mind. Is it Mind?
I see.
And we did like a worry box.
Fine. Okay.
So all his worries we used to put in a box.
Yeah. I mean, it's interesting. It's obviously not there the whole time, and it wasn't there always. And that encourages me that actually this isn't going to be a thing that you're going to have
that's what I'm
lasting, ongoing
thinking.
problems with. The thing we do is to ask what we call a speech and language therapist to see you. So there are people who specialise in speech and language, so in the ability to communicate. And they do look at this as a problem. Do we need to do that yet or not? Maybe have a think about that. And if actually you get home and think, well, no, I do want something done about it, I will make that referral. But I also don't want to...
No, maybe we'll leave it for a bit longer then and just see.
Yeah?
See if it calms down.
Do you want me to give you a list of sort of resources you could look up?
Yeah.
Yeah? Patient.co.uk or NHS Choices.
Thank you, Doctor.
Okay, lovely. Very nice to see you.
Yeah, nice to see you. See you later.
Bye, Freddie.
Bye.
Bye.
Nice to see
It's
you.
been nice meeting you.
You too. Bye-bye.
Bye-bye.
See you later.
Alligator.
In a while, crocodile.
Thank you. That's the plan. Great. Cheers then. Bye.
Thank you so very much for seeing
That's all right. Nice to see you.
Hello, sweetheart. Bye-bye. Enjoy your... Yes, you're gorgeous, aren't you? Bye-bye.